Injury is physiological damage to the living tissue of any organism, whether in humans, in other animals, or in plants. Injuries can be caused in many ways, such as mechanically with penetration by sharp objects such as teeth or with blunt objects, by heat or cold, or by venoms and biotoxins. Injury prompts an inflammatory response in many taxa of animals. This prompts wound healing. In both plants and animals, substances are often released to help to occlude the wound, limiting loss of fluids and the entry of pathogens such as bacteria. Many organisms secrete antimicrobial chemicals which limit wound infection. In addition, animals have a variety of immune responses for the same purpose. Both plants and animals have regrowth mechanisms which may result in complete or partial healing over the injury. Taxonomic range. Animals. A sand lizard that has shed its tail when attacked by a predator, and has started to regrow a tail from the site of the injury. Main article, Injury in Animals. Injury in animals is sometimes defined as mechanical damage to anatomical structure, 1, but it has a wider connotation of physical damage with any cause, including drowning, burns, and poisoning. 2, such damage may result from attempted predation, territorial fights, falls, and abiotic factors. 2. Injury prompts an inflammatory response in animals of many different phyla. Wink with a frown. 3. This prompts coagulation of the blood or body fluid. 4. Followed by wound healing, which may be rapid, as in the cnidaria. 3. Arthropods are able to repair injuries to the cuticle that forms their exoskeleton to some extent. 5. Animals in several phyla, including annelids, arthropods, cnidaria, mollusks, nematodes, and vertebrates are able to produce antimicrobial peptides to fight off infection following an injury. 1. Humans. Injuries to humans elicit an elaborate response including emergency medicine, trauma surgery, illustrated, and pain management. Main article, Injury in Humans. Injury in humans has been studied extensively for its importance in medicine. Much of medical practice including emergency medicine and pain management is dedicated to the treatment of injuries. 6. 7. The World Health Organization has developed a classification of injuries in humans by categories including mechanism, object/substances producing injury, place of occurrence, activity when injured and the role of human intent. 8. Injuries often cause psychological harm including post-traumatic stress disorder in addition to physical harm. 9. Plants. Oak tree split by lightning, an abiotic cause of injury. Main article, Injury in Plants. In plants, injuries result from the eating of plant parts by herbivorous animals including insects and mammals. 10. From damage to tissues by plant pathogens such as bacteria and fungi, which may gain entry after herbivore damage or in other ways. 11. And from abiotic factors such as heat. 12. Freezing. 13. Flooding. 14. Lightning. 15. And pollutants. 16. Such as ozone. 17. Plants respond to injury by signaling that damage has occurred. 18. By secreting materials to seal off the damaged area. 19. By producing antimicrobial chemicals. 20. 21. And in woody plants by regrowing over wounds. 22. 23. 24. Cell injury. Main article, Cell injury. Cell injury is a variety of changes of stress that a cell suffers due to external as well as internal environmental changes. Amongst other causes, this can be due to physical, chemical, infectious, biological, nutritional, or immunological factors. Cell damage can be reversible or irreversible. Depending on the extent of injury, the cellular response may be adaptive and where possible, homeostasis is restored. 25. Cell death occurs when the severity of the injury exceeds the cell's ability to repair itself. 26. Cell death is relative to both the length of exposure to a harmful stimulus and the severity of the damage caused. 25. A disease is a particular abnormal condition that negatively affects the structure or function of all or part of an organism and is not immediately due to any external injury. 1. 2. Diseases are often known to be medical conditions that are associated with specific signs and symptoms. A disease may be caused by external factors such as pathogens or by internal dysfunctions. For example, internal dysfunctions of the immune system can produce a variety of different diseases, including various forms of immunodeficiency, hypersensitivity, allergies, and autoimmune disorders. In humans, disease is often used more broadly to refer to any condition that causes pain, dysfunction, distress, social problems, or death to the person affected, or similar problems for those in contact with the person. In this broader sense, it sometimes includes injuries, disabilities, disorders, syndromes, infections, isolated symptoms, deviant behaviors, and atypical variations of structure and function, while in other contexts and for other purposes these may be considered distinguishable categories. Diseases can affect people not only physically but also mentally, as contracting and living with a disease can alter the affected person's perspective on life. Death due to disease is called death by natural causes. There are 4 main types of disease: infectious diseases, deficiency diseases, hereditary diseases, including both genetic and non-genetic hereditary diseases, and physiological diseases. Diseases can also be classified in other ways, such as communicable versus non-communicable diseases. The deadliest diseases in humans are coronary artery disease, blood flow obstruction, followed by cerebrovascular disease and lower respiratory infections. 3. In developed countries, the diseases that cause the most sickness overall are neuropsychiatric conditions, such as depression and anxiety. The study of disease is called pathology, which includes the study of etiology, or cause. Terminology. Concepts. In many cases, terms such as disease, disorder, morbidity, sickness, and illness are used interchangeably. However, there are situations when specific terms are considered preferable. 4. Disease. The term disease broadly refers to any condition that impairs the normal functioning of the body. For this reason, diseases are associated with the dysfunction of the body's normal homeostatic processes. 5. Commonly, the term is used to refer specifically to infectious diseases, which are clinically evident diseases that result from the presence of pathogenic microbial agents, including viruses, bacteria, fungi, protozoa, multicellular organisms, and aberrant proteins known as prion. An infection or colonization that does not and will not produce clinically evident impairment of normal functioning, such as the presence of the normal bacteria and yeasts in the gut, or of a passenger virus, is not considered a disease. By contrast, an infection that is asymptomatic during its incubation period, but expected to produce symptoms later, is usually considered a disease. Non-infectious diseases are all other diseases, including most forms of cancer, heart disease, and genetic disease. Acquired disease. An acquired disease is one that began at some point during one's lifetime, as opposed to disease that was already present at birth, which is congenital disease. Acquired sounds like it could mean caught via contagion, but it simply means acquired sometime after birth. It also sounds like it could imply secondary disease, but acquired disease can be primary disease. Acute disease. An acute disease is one of a short-term nature, acute. The term sometimes also connotes a fulminant nature. Chronic condition or chronic disease. A chronic disease is one that persists over time, often for at least 6 months, but may also include illnesses that are expected to last for the entirety of one's natural life. Congenital disorder or congenital disease. A congenital disorder is one that is present at birth. It is often a genetic disease or disorder and can be inherited. It can also be the result of a vertically transmitted infection from the mother, such as HIV/AIDS. Genetic disease. A genetic disorder or disease is caused by one or more genetic mutations. It is often inherited, but some mutations are random and de novo. Hereditary or inherited disease. A hereditary disease is a type of genetic disease caused by genetic mutations that are hereditary and can run in families. Iatrogenic disease. An iatrogenic disease or condition is one that is caused by medical intervention, whether as a side effect of a treatment or as an inadvertent outcome. Idiopathic disease. An idiopathic disease has an unknown cause or source. As medical science has advanced, many diseases with entirely unknown causes have had some aspects of their sources explained and therefore shed their idiopathic status. For example, when germs were discovered, it became known that they were a cause of infection, but particular germs and diseases had not been linked. In another example, it is known that autoimmunity is the cause of some forms of diabetes mellitus type 1, even though the particular molecular pathways by which it works are not yet understood. It is also common to know certain factors are associated with certain diseases. However, association does not necessarily imply causality. For example, a third factor might be causing both the disease and the associated phenomenon. Incurable disease. A disease that cannot be cured. Incurable diseases are not necessarily terminal diseases, and sometimes a disease's symptoms can be treated sufficiently for the disease to have little or no impact on quality of life. Primary disease. A primary disease is a disease that is due to a root cause of illness, as opposed to secondary disease, which is a sequela, or complication that is caused by the primary disease. For example, a common cold is a primary disease, where rhinitis is a possible secondary disease, or sequela. A doctor must determine what primary disease, a cold or bacterial infection, is causing a patient's secondary rhinitis when deciding whether or not to prescribe antibiotics. Secondary disease. A secondary disease is a disease that is a sequela or complication of a prior, causal disease, which is referred to as the primary disease or simply the underlying cause, root cause. For example, a bacterial infection can be primary, wherein a healthy person is exposed to bacteria and becomes infected, or it can be secondary to a primary cause that predisposes the body to infection. For example, a primary viral infection that weakens the immune system could lead to a secondary bacterial infection. Similarly, a primary burn that creates an open wound could provide an entry point for bacteria and lead to a secondary bacterial infection. Terminal disease. A terminal disease is one that is expected to have the inevitable result of death. Previously, AIDS was a terminal disease. It is now incurable, but can be managed indefinitely using medications. Illness. The terms illness and sickness are both generally used as synonyms for disease. However, the term illness is occasionally used to refer specifically to the patient's personal experience of their disease. 6, 7, 8, 9. In this model, it is possible for a person to have a disease without being ill, to have an objectively definable, but asymptomatic, medical condition, such as a subclinical infection, or to have a clinically apparent physical impairment but not feel sick or distressed by it, and to be ill without being diseased, such as when a person perceives a normal experience as a medical condition, or medicalizes a non-disease situation in their life. For example, a person who feels unwell as a result of embarrassment, and who interprets those feelings as sickness rather than normal emotions. Symptoms of illness are often not directly the result of infection, but a collection of evolved responses, sickness behavior by the body, that helps clear infection and promote recovery. Such aspects of illness can include lethargy, depression, loss of appetite, sleepiness, hyperalgesia, and inability to concentrate. 10, 11, 12. Disorder. A disorder is a functional abnormality or disturbance. Medical disorders can be categorized into mental disorders, physical disorders, genetic disorders, emotional and behavioral disorders, and functional disorders. The term disorder is often considered more value-neutral and less stigmatizing than the terms disease or illness, and therefore is preferred terminology in some circumstances. 13. In mental health, the term mental disorder is used as a way of acknowledging the complex interaction of biological, social, and psychological factors in psychiatric conditions. However, the term disorder is also used in many other areas of medicine, primarily to identify physical disorders that are not caused by infectious organisms, such as metabolic disorders. Medical condition or health condition. A medical condition or health condition is a broad concept that includes all diseases, lesions, disorders, or non-pathologic condition that normally receives medical treatment, such as pregnancy or childbirth. While the term medical condition generally includes mental illnesses, in some contexts the term is used specifically to denote any illness, injury, or disease except for mental illnesses. The Diagnostic and Statistical Manual of Mental Disorders, DSM, the widely used psychiatric manual that defines all mental disorders, uses the term general medical condition to refer to all diseases, illnesses, and injuries except for mental disorders. 14. This usage is also commonly seen in the psychiatric literature. Some health insurance policies also define a medical condition as any illness, injury, or disease except for psychiatric illnesses. 15. As it is more value-neutral than terms like disease, the term medical condition is sometimes preferred by people with health issues that they do not consider deleterious. On the other hand, by emphasizing the medical nature of the condition, this term is sometimes rejected, such as by proponents of the autism rights movement. The term medical condition is also a synonym for medical state, in which case it describes an individual patient's current state from a medical standpoint. This usage appears in statements that describe a patient as being in critical condition, for example, morbidity. Morbidity, from Latin morbidus sick, unhealthy, is a diseased state, disability, or poor health due to any cause. 16. the term may refer to the existence of any form of disease, or to the degree that the health condition affects the patient. Among severely ill patients, the level of morbidity is often measured by ICU scoring systems. Comorbidity, or coexisting disease, is the simultaneous presence of two or more medical conditions, such as schizophrenia and substance abuse. In epidemiology and actuarial science, the term morbidity, also morbidity rate or morbidity frequency, can refer to either the incidence rate, the prevalence of a disease or medical condition, or the percentage of people who experience a given condition within a given timeframe. Example, 20% of people will get influenza in a year. 17. This measure of sickness is contrasted with the mortality rate of a condition, which is the proportion of people dying during a given time interval. Morbidity rates are used in actuarial professions, such as health insurance, life insurance, and long-term care insurance, to determine the premiums charged to customers. Morbidity rates help insurers predict the likelihood that an insured will contract or develop any number of specified diseases. Pathosis or pathology. Pathosis, plural pathoses, is synonymous with disease. The word pathology also has this sense, in which it is commonly used by physicians in the medical literature, although some editors prefer to reserve pathology to its other senses. Sometimes a slight connotative shade causes preference for pathology or pathosis, implying some, as yet poorly analyzed, pathophysiologic process rather than disease, implying a specific disease entity as defined by diagnostic criteria being already met. This is hard to quantify denotatively, but it explains why cognitive synonymy is not invariable. Syndrome. A syndrome is the association of several signs and symptoms, or other characteristics that often occur together, regardless of whether the cause is known. Some syndromes, such as Down syndrome, are known to have only one cause, an extra chromosome at birth. Others, such as Parkinsonian syndrome, are known to have multiple possible causes. Acute coronary syndrome, for example, is not a single disease itself but is rather the manifestation of any of several diseases, including myocardial infarction secondary to coronary artery disease. In yet other syndromes, however, the cause is unknown. A familiar syndrome name often remains in use even after an underlying cause has been found or when there are a number of different possible primary causes. Examples of the first mentioned type are that Turner syndrome and DeGeorge syndrome are still often called predisease. Predisease is a subclinical or prodromal vanguard of a disease. Prediabetes and prehypertension are common examples. The nosology or epistemology of predisease is contentious, though, because there is seldom a bright line differentiating a legitimate concern for subclinical or premonitory status and the conflict of interest driven over-medicalization, example, by pharmaceutical manufacturers, or demedicalization, example, by medical and disability insurers. Identifying legitimate predisease can result in useful preventive measures, such as motivating the person to get a healthy amount of physical exercise. 18. But labeling a healthy person with an unfounded notion of predisease can result in overtreatment, such as taking drugs that only help people with severe disease or paying for treatments with a poor benefit-cost ratio. One review proposed 3 criteria for predisease. A high risk for progression to disease, making one far more likely to develop it than others are, for example, a precancer will almost certainly turn into cancer over time. Actionability for risk reduction, for example, removal of the precancerous tissue prevents it from turning into a potentially deadly cancer. Benefit that outweighs the harm of any interventions taken, removing the precancerous tissue prevents cancer, and thus prevents a potential death from cancer. 19. Types by body system. Mental illness is a broad, generic label for a category of illnesses that may include affective or emotional instability, behavioral dysregulation, cognitive dysfunction, or impairment. Specific illnesses known as mental illnesses include major depression, generalized anxiety disorders, schizophrenia, and attention deficit hyperactivity disorder, to name a few. Mental illness can be of biological, example, anatomical, chemical, or genetic, or psychological, example, trauma or conflict, origin. It can impair the affected person's ability to work or study and can harm interpersonal relationships. The term insanity is used technically as a legal term, citation needed. Organic. An organic disease is one caused by a physical or physiological change to some tissue or organ of the body. The term sometimes excludes infections. It is commonly used in contrast with mental disorders. It includes emotional and behavioral disorders if they are due to changes to the physical structures or functioning of the body, such as after a stroke or a traumatic brain injury, but not if they are due to psychosocial issues. Stages. In an infectious disease, the incubation period is the time between infection and the appearance of symptoms. The latency period is the time between infection and the ability of the disease to spread to another person, which may precede, follow, or be simultaneous with the appearance of symptoms. Some viruses also exhibit a dormant phase, called viral latency, in which the virus hides in the body in an inactive state. For example, varicella-zoster virus causes chickenpox in the acute phase. After recovery from chickenpox, the virus may remain dormant in nerve cells for many years, and later cause herpes zoster, shingles. Acute disease. An acute disease is a short-lived disease, like the common cold. Chronic disease. A chronic disease is one that lasts for a long time, usually at least 6 months. During that time, it may be constantly present, or it may go into remission and periodically relapse. A chronic disease may be stable, does not get any worse, or it may be progressive, gets worse over time. Some chronic diseases can be permanently cured. Most chronic diseases can be beneficially treated, even if they cannot be permanently cured. Clinical disease. One that has clinical consequences, in other words, the stage of the disease that produces the characteristic signs and symptoms of that disease. 20. AIDS is the clinical disease stage of HIV infection. Cure. A cure is the end of a medical condition or a treatment that is very likely to end it, while remission refers to the disappearance, possibly temporarily, of symptoms. Complete remission is the best possible outcome for incurable diseases. Flare-up. Flare-up redirects here. For the Transformers character, see Flare-up, Transformers. See also, exacerbation. A flare-up can refer to either the recurrence of symptoms or an onset of more severe symptoms. 21. Progressive disease. Progressive disease is a disease whose typical natural course is the worsening of the disease until death, serious debility, or organ failure occurs. Slowly progressive diseases are also chronic diseases, many are also degenerative diseases. The opposite of progressive disease is stable disease or static disease, a medical condition that exists, but does not get better or worse. Refractory disease. A refractory disease is a disease that resists treatment, especially an individual case that resists treatment more than is normal for the specific disease in question. Subclinical disease. Also called silent disease, silent stage, or asymptomatic disease. This is a stage in some diseases before the symptoms are first noted. 22. Terminal phase. If a person will die soon from a disease, regardless of whether that disease typically causes death, then the stage between the earlier disease process and active dying is the terminal phase. Recovery. See also, convalescence and recuperation. Recovery can refer to the repairing of physical processes, tissues, organs etc., and the resumption of healthy functioning after damage-causing processes have been cured. Extent. Skin rash on the leg. This rash only affects one part of the body, so it is a localized disease. Localized disease. A localized disease is one that affects only one part of the body, such as athlete's foot or an eye infection. Disseminated disease. A disseminated disease has spread to other parts. With cancer, this is usually called metastatic disease. Systemic disease. A systemic disease is a disease that affects the entire body, such as influenza or high blood pressure. Classification. Main articles, Nosology and Medical Classification. Diseases may be classified by cause, pathogenesis, mechanism by which the disease is caused, or by symptoms. Alternatively, diseases may be classified according to the organ system involved, though this is often complicated since many diseases affect more than one organ. A chief difficulty in nosology is that diseases often cannot be defined and classified clearly, especially when cause or pathogenesis are unknown. Thus diagnostic terms often only reflect a symptom or set of symptoms, syndrome. Classical classification of human disease derives from the observational correlation between pathological analysis and clinical syndromes. Today it is preferred to classify them by their cause if it is known. 23. The most known and used classification of diseases is the World Health Organization's ICD. This is periodically updated. Currently, the last publication is the ICD-11. Causes. See also, cause, medicine, and transmission, medicine. Diseases can be caused by any number of factors and may be acquired or congenital. Microorganisms, genetics, the environment or a combination of these can contribute to a diseased state. 24. Only some diseases such as influenza are contagious and commonly believed infectious. The microorganisms that cause these diseases are known as pathogens and include varieties of bacteria, viruses, protozoa, and fungi. Infectious diseases can be transmitted, e.g. by hand-to-mouth contact with infectious material on surfaces, by bites of insects or other carriers of the disease, and from contaminated water or food, often via fecal contamination, etc. 25. Also, there are sexually transmitted diseases. In some cases, microorganisms that are not readily spread from person to person play a role, while other diseases can be prevented or ameliorated with appropriate nutrition or other lifestyle changes. Some diseases, such as most, but not all, forms of cancer, heart disease, and mental disorders, are non-infectious diseases. Many non-infectious diseases have a partly or completely genetic basis, see genetic disorder, and may thus be transmitted from one generation to another. Social determinants of health are the social conditions in which people live that determine their health. Illnesses are generally related to social, economic, political, and environmental circumstances. 26. Social determinants of health have been recognized by several health organizations such as the Public Health Agency of Canada and the World Health Organization to greatly influence collective and personal well-being. The World Health Organization's Social Determinants Council also recognizes social determinants of health in poverty. When the cause of a disease is poorly understood, societies tend to mythologize the disease or use it as a metaphor or symbol of whatever that culture considers evil. For example, until the bacterial cause of tuberculosis was discovered in 1882, experts variously ascribed the disease to heredity, a sedentary lifestyle, depressed mood, and overindulgence in sex, rich food, or alcohol, all of which were social ills at the time. 27. When a disease is caused by a pathogenic organism, example, when malaria is caused by Plasmodium, one should not confuse the pathogen, the cause of the disease, with disease itself. For example, West Nile virus, the pathogen, causes West Nile fever, the disease. The misuse of basic definitions in epidemiology is frequent in scientific publications. 28. Types of causes. A child rides a bicycle. An adult and a child walk a dog along a path in a green park. Regular physical activity, such as riding a bicycle or walking, reduces the risk of lifestyle diseases. Airborne. An airborne disease is any disease that is caused by pathogens and transmitted through the air. Foodborne. Foodborne illness or food poisoning is any illness resulting from the consumption of food contaminated with pathogenic bacteria, toxins, viruses, prion or parasites. Infectious. Infectious diseases, also known as transmissible diseases or communicable diseases, comprise clinically evident illness, i.e., characteristic medical signs or symptoms of disease, resulting from the infection, presence and growth of pathogenic biological agents in an individual host organism. Included in this category are contagious diseases, an infection, such as influenza or the common cold, that commonly spreads from one person to another, and communicable diseases, a disease that can spread from one person to another, but does not necessarily spread through everyday contact. Lifestyle. A lifestyle disease is any disease that appears to increase in frequency as countries become more industrialized and people live longer, especially if the risk factors include behavioral choices like a sedentary lifestyle or a diet high in unhealthful foods such as refined carbohydrates, trans fats, or alcoholic beverages. Non-communicable. A non-communicable disease is a medical condition or disease that is non-transmissible. Non-communicable diseases cannot be spread directly from one person to another. Heart disease and cancer are examples of non-communicable diseases in humans. Prevention. Main article, Preventive Medicine. Many diseases and disorders can be prevented through a variety of means. These include sanitation, proper nutrition, adequate exercise, vaccinations and other self-care and public health measures, such as obligatory face mask mandates, citation needed. Treatments. Main article, Therapy. Medical therapies or treatments are efforts to cure or improve a disease or other health problems. In the medical field, therapy is synonymous with the word treatment. Among psychologists, the term may refer specifically to psychotherapy or talk therapy. Common treatments include medications, surgery, medical devices, and self-care. Treatments may be provided by an organized healthcare system or informally, by the patient or family members. Preventive healthcare is a way to avoid an injury, sickness, or disease in the first place. A treatment or cure is applied after a medical problem has already started. A treatment attempts to improve or remove a problem, but treatments may not produce permanent cures, especially in chronic diseases. Cures are a subset of treatments that reverse diseases completely or end medical problems permanently. Many diseases that cannot be completely cured are still treatable. Pain management, also called pain medicine, is that branch of medicine employing an interdisciplinary approach to the relief of pain and improvement in the quality of life of those living with pain. 29. Treatment for medical emergencies must be provided promptly, often through an emergency department or, in less critical situations, through an urgent care facility. Epidemiology. Main article, Epidemiology. Epidemiology is the study of the factors that cause or encourage diseases. Some diseases are more common in certain geographic areas, among people with certain genetic or socioeconomic characteristics, or at different times of the year. Epidemiology is considered a cornerstone methodology of public health research and is highly regarded in evidence-based medicine for identifying risk factors for diseases. In the study of communicable and non-communicable diseases, the work of epidemiologists ranges from outbreak investigation to study design, data collection, and analysis, including the development of statistical models to test hypotheses and the documentation of results for submission to peer-reviewed journals. Epidemiologists also study the interaction of diseases in a population, a condition known as a syndemic. Epidemiologists rely on a number of other scientific disciplines such as biology, to better understand disease processes, biostatistics, the current raw information available, geographic information science, to store data and map disease patterns, and social science disciplines, to better understand proximate and distal risk factors. Epidemiology can help identify causes as well as guide prevention efforts. In studying diseases, epidemiology faces the challenge of defining them. Especially for poorly understood diseases, different groups might use significantly different definitions. Without an agreed-on definition, different researchers may report different numbers of cases and characteristics of the disease. 30. Some morbidity databases are compiled with data supplied by states and territories' health authorities, at national levels, 31, 32, or larger scale, such as European Hospital Morbidity Database, HMDB, 33, which may contain hospital discharge data by detailed diagnosis, age and sex. The European HMDB data was submitted by European countries to the World Health Organization Regional Office for Europe. Burdens of disease. Disease burden is the impact of a health problem in an area measured by financial cost, mortality, morbidity, or other indicators. There are several measures used to quantify the burden imposed by diseases on people. The years of potential life lost, YPLL, is a simple estimate of the number of years that a person's life was shortened due to a disease. For example, if a person dies at the age of 65 from a disease, and would probably have lived until age 80 without that disease, then that disease has caused a loss of 15 years of potential life. YPLL measurements do not account for how disabled a person is before dying, so the measurement treats a person who dies suddenly and a person who died at the same age after decades of illness as equivalent. In 2004, the World Health Organization calculated that 932 million years of potential life were lost to premature death. 34. The quality-adjusted life year, QALY, and disability-adjusted life year, DALY, metrics are similar but take into account whether the person was healthy after diagnosis. In addition to the number of years lost due to premature death, these measurements add part of the years lost to being sick. Unlike YPLL, these measurements show the burden imposed on people who are very sick, but who live a normal lifespan. A disease that has high morbidity, but low mortality, has a high DALY and a low YPLL. In 2004, the World Health Organization calculated that 1.5 billion disability-adjusted life years were lost to disease and injury. 34. In the developed world, heart disease and stroke cause the most loss of life, but neuropsychiatric conditions like major depressive disorder cause the most years lost to being sick. Disease category: % of all YPLLs lost, worldwide, 34%, of all DALYs lost, worldwide, 34%, of all YPLLs lost, Europe, 34%, percent of all dailies lost, Europe, 34% of all YPLLs lost, US and Canada, 34% of all dailies lost, US and Canada, 34. Infectious and parasitic diseases, especially lower respiratory tract infections, diarrhea, AIDS, tuberculosis, and malaria, 37%, 26%, 9%, 6%, 5%, 3%. Neuropsychiatric conditions, e.g. depression, 2%, 13%, 3%, 19%, 5%, 28%. Injuries, especially motor vehicle accidents, 14%, 12%, 18%, 13%, 18%, 10%. Cardiovascular diseases, principally heart attacks and stroke, 14%, 10%, 35%, 23%, 26%, 14%. Premature birth and other perinatal deaths, 11%, 8%, 4%, 2%, 3%, 2%. Cancer, 8%, 5%, 19%, 11%, 25%, 13%. Society and culture. Obesity was a status symbol in Renaissance culture. The Tuscan general Alessandro del Boro, attributed to Andrea Sacchi, 1645-35, it is now generally regarded as a disease. How a society responds to diseases is the subject of medical sociology. A condition may be considered a disease in some cultures or eras but not in others. For example, obesity can represent wealth and abundance, and is a status symbol in famine-prone areas and some places hard hit by HIV/AIDS. 36. Epilepsy is considered a sign of spiritual gifts among the Hmong people. 37. Sickness confers the social legitimization of certain benefits, such as illness benefits, work avoidance, and being looked after by others. The person who is sick takes on a social role called the sick role. A person who responds to a dreaded disease, such as cancer, in a culturally acceptable fashion may be publicly and privately honored with higher social status. 38. In return for these benefits, the sick person is obligated to seek treatment and work to become well once more. As a comparison, consider pregnancy, which is not interpreted as a disease or sickness, even if the mother and baby may both benefit from medical care. Burdens of disease. Disease burden is the impact of a health problem in an area measured by financial cost, mortality, morbidity, or other indicators. There are several measures used to quantify the burden imposed by diseases on people. The years of potential life lost, YPLL, is a simple estimate of the number of years that a person's life was shortened due to a disease. For example, if a person dies at the age of 65 from a disease, and would probably have lived until age 80 without that disease, then that disease has caused a loss of 15 years of potential life. YPLL measurements do not account for how disabled a person is before dying, so the measurement treats a person who dies suddenly and a person who died at the same age after decades of illness as equivalent. In 2004, the World Health Organization calculated that 932 million years of potential life were lost to premature death. 34. The quality-adjusted life year, QALY, and disability-adjusted life year, DALY, metrics are similar but take into account whether the person was healthy after diagnosis. In addition to the number of years lost due to premature death, these measurements add part of the years lost to being sick. Unlike YPLL, these measurements show the burden imposed on people who are very sick, but who live a normal lifespan. A disease that has high morbidity, but low mortality, has a high DALY and a low YPLL. In 2004, the World Health Organization calculated that 1.5 billion disability-adjusted life years were lost to disease and injury. 34. In the developed world, heart disease and stroke cause the most loss of life, but neuropsychiatric conditions like major depressive disorder cause the most years lost to being sick. Disease category: percent of all YPLLs lost, worldwide, 34%, of all dailies lost, worldwide, 34%, of all YPLLs lost, Europe, 34%, of all dailies lost, Europe, 34%, of all YPLLs lost, US and Canada, 34%, of all dailies lost, US and Canada, 34%. Infectious and parasitic diseases, especially lower respiratory tract infections, diarrhea, AIDS, tuberculosis, and malaria, 37%, 26%, 9%, 6%, 5%, 3%. Neuropsychiatric conditions, e.g. depression, 2%, 13%, 3%, 19%, 5%, 28%. Injuries, especially motor vehicle accidents, 14%, 12%, 18%, 13%, 18%, 10%. Cardiovascular diseases, principally heart attacks and stroke, 14%, 10%, 35%, 23%, 26%, 14%. Premature birth and other perinatal deaths, 11%, 8%, 4%, 2%, 3%, 2%. Cancer, 8%, 5%, 19%, 11%, 25%, 13%. Society and culture. Obesity was a status symbol in Renaissance culture. The Tuscan general Alessandro del Boro, attributed to Andrea Sacchi, 1645-35, it is now generally regarded as a disease. How a society responds to diseases is the subject of medical sociology. A condition may be considered a disease in some cultures or eras but not in others. For example, obesity can represent wealth and abundance, and is a status symbol in famine-prone areas and some places hard hit by HIV/AIDS. 36. Epilepsy is considered a sign of spiritual gifts among the Hmong people. 37. Sickness confers the social legitimization of certain benefits, such as illness benefits, work avoidance, and being looked after by others. The person who is sick takes on a social role called the sick role. A person who responds to a dreaded disease, such as cancer, in a culturally acceptable fashion may be publicly and privately honored with higher social status. 38. In return for these benefits, the sick person is obligated to seek treatment and work to become well once more. As a comparison, consider pregnancy, which is not interpreted as a disease or sickness, even if the mother and baby may both benefit from medical care. Most religions grant exceptions from religious duties to people who are sick. For example, one whose life would be endangered by fasting on Yom Kippur or during Ramadan is exempted from the requirement, or even forbidden from participating. People who are sick are also exempted from social duties. For example, ill health is the only socially acceptable reason for an American to refuse an invitation to the White House. 39. The identification of a condition as a disease, rather than as simply a variation of human structure or function, can have significant social or economic implications. The controversial recognition of diseases such as repetitive stress injury, RSI, and post-traumatic stress disorder, PTSD, has had a number of positive and negative effects on the financial and other responsibilities of governments, corporations, and institutions towards individuals, as well as on the individuals themselves. The social implication of viewing aging as a disease could be profound, though this classification is not yet widespread. Lepers were people who were historically shunned because they had an infectious disease, and the term leper still evokes social stigma. Fear of disease can still be a widespread social phenomenon, though not all diseases evoke extreme social stigma. Social standing and economic status affect health. Diseases of poverty are diseases that are associated with poverty and low social status. Diseases of affluence are diseases that are associated with high social and economic status. Which diseases are associated with which states vary according to time, place, and technology. Some diseases, such as diabetes mellitus, may be associated with both poverty, poor food choices, and affluence, long lifespans and sedentary lifestyles, through different mechanisms. The term lifestyle diseases describes diseases associated with longevity and that are more common among older people. For example, cancer is far more common in societies in which most members live until they reach the age of 80 than in societies in which most members die before they reach the age of 50. Language of disease. An illness narrative is a way of organizing a medical experience into a coherent story that illustrates the sick individual's personal experience. People use metaphors to make sense of their experiences with disease. The metaphors move disease from an objective thing that exists to an affective experience. The most popular metaphors draw on military concepts. Disease is an enemy that must be feared, fought, battled, and routed. The patient or the healthcare provider is a warrior, rather than a passive victim or bystander. The agents of communicable diseases are invaders. Non-communicable diseases constitute internal insurrection or civil war. Because the threat is urgent, perhaps a matter of life and death, unthinkably radical, even oppressive, measures are society's and the patient's moral duty as they courageously mobilize to struggle against destruction. The war on cancer is an example of this metaphorical use of language. 40. This language is empowering to some patients, but leaves others feeling like they are failures. 41. Another class of metaphors describes the experience of illness as a journey. the person travels to or from a place of disease, and changes himself, discovers new information, or increases his experience along the way. He may travel on the road to recovery or make changes to get on the right track or choose pathways. 41. Some are explicitly immigration-themed. The patient has been exiled from the home territory of health to the land of the ill, changing identity and relationships in the process. 42. This language is more common among British healthcare professionals than the language of physical aggression. 41. Some metaphors are disease-specific. Slavery is a common metaphor for addictions. The alcoholic is enslaved by drink, and the smoker is captive to nicotine. Some cancer patients treat the loss of their hair from chemotherapy as a metonymy or metaphor for all the losses caused by the disease. 40. Some diseases are used as metaphors for social ills. Cancer is a common description for anything that is endemic and destructive in society, such as poverty, injustice, or racism. AIDS was seen as a divine judgment for moral decadence, and only by purging itself from the pollution of the invader could society become healthy again. 40. More recently, when AIDS seemed less threatening, this type of emotive language was applied to avian flu and type 2 diabetes mellitus. 43. Authors in the 19th century commonly used tuberculosis as a symbol and a metaphor for transcendence. People with the disease were portrayed in literature as having risen above daily life to become ephemeral objects of spiritual or artistic achievement. In the 20th century, after its cause was better understood, the same disease became the emblem of poverty, squalor, and other social problems. 42. See also: Icon Medicine Portal, Icon Biology Portal, Cryptogenic Disease, a disease whose cause is currently unknown, Developmental Disability, severe, lifelong disabilities attributable to mental or physical impairments, Environmental Disease, Host, Pathogen Interaction, Lists of Diseases, Mitochondrial Disease, Philosophy of Medicine, Plant Pathology, Rare Disease, a disease that affects very few people, Sociology of Health and Illness, Syndrome. Health promotion is, as stated in the 1986 World Health Organization, WHO, Ottawa Charter for Health Promotion, the process of enabling people to increase control over, and to improve their health. 1. 2. Scope. The WHO's 1986 Ottawa Charter for Health Promotion and then the 2005 Bangkok Charter for Health Promotion in a globalized world defines health promotion as the process of enabling people to increase control over their health and its determinants, and thereby improve their health. 3. Health promotion involves public policy that addresses health determinants such as income, housing, food security, employment, and quality working conditions. 4. More recent work has used the term health in all policies, high AP, to refer to the actions that incorporate health into all public policies. Health promotion is aligned with health equity and can be a focus of non-governmental organizations, NGOs, dedicated to social justice or human rights. Health literacy can be developed in schools, while aspects of health promotion such as breastfeeding promotion can depend on laws and rules of public spaces. One of the Ottawa Charter health promotion action items is infusing prevention into all sectors of society. To that end, it is seen in preventive healthcare rather than a treatment and curative care-focused medical model. Citation needed. There is a tendency among some public health officials, governments, and the medical industrial complex to reduce health promotion to just developing personal skills, also known as health education and social marketing focused on changing behavioral risk factors. 5. However, recent evidence suggests that attitudes about public health policies are less about personal abilities or health messaging than about individuals' philosophical beliefs about morality, politics, and science. 6. History. This first publication of health promotion is from the 1974 Lalonde Report from the Government of Canada. 7, which contained a health promotion strategy aimed at informing, influencing, and assisting both individuals and organizations so that they will accept more responsibility and be more active in matters affecting mental and physical health. 8. Another predecessor of the definition was the 1979 Healthy People Report of the Surgeon General of the United States. 7, which noted that health promotion seeks the development of community and individual measures which can help people to develop lifestyles that can maintain and enhance the state of well-being. 9. At least 2 publications led to a broad empowerment/environmental definition of health promotion in the mid-1980s. Frowny face 7. In the year 1984, the WHO Regional Office for Europe defined health promotion as the process of enabling people to increase control over, and to improve their health. 10. In addition to methods to change lifestyles, the WHO Regional Office advocated legislation, fiscal measures, organizational change, community development and spontaneous local activities against health hazards as health promotion methods. 10. In 1986, Jacob, Canadian Minister of National Health and Welfare, released Achieving Health for All, a framework for health promotion which also came to be known as the EP Report. 7. 11. This report defined the three mechanisms of health promotion as self-care, mutual aid, or the actions people take to help each other cope, and healthy environments. 11. First International Conference on Health Promotion, Ottawa, 1986, which resulted in the Ottawa Charter for Health Promotion. 12. According to the Ottawa Charter, health promotion frowny face 12 is not just the responsibility of the health sector, but goes beyond healthy lifestyles to well-being. Aims at making political, economic, social, cultural, environmental, behavioral and biological factors favorable through advocacy for health. Focuses on achieving equity in health. Demands coordinated action by all concerned, by governments, by health and other social organizations. The American definition of health promotion, first promulgated by the American Journal of Health Promotion in the late 1980s, focuses more on the delivery of services with a biobehavioral approach rather than environmental support using a settings approach. Later the power on the environment over behavior was incorporated. The Health Promotion Glossary 2021 reinforces the international 1986 definition, citation needed. The WHO, in collaboration with other organizations, has subsequently co-sponsored international conferences including the 2015 Okanagan Charter on Health Promotion Universities and Colleges, citation needed. In November 2019, researchers reported, based on an international study of 27 countries, that caring for families is the main motivator for people worldwide. 14. Settings-based approach. The WHO's settings approach to health promotion, Healthy Settings, looks at the settings as individual systems that link community participation, equity, empowerment, and partnership to actions that promote health. According to the WHO, a setting is the place or social context in which people engage in daily activities in which environmental, organizational, and personal factors interact to affect health and well-being. 15. There are 11 recognized settings in this approach: cities, villages, municipalities and communities, schools, workplaces, markets, homes, islands, hospitals, prisons, and universities, citation needed. Health promoting hospitals. Health promotion in the hospital setting aims to increase health gain by supporting the health of patients, staff, and the community. This is achieved by integrating health promotion concepts, strategies, and values into the culture and organizational structure of the hospital. Specifically, this means setting up a management structure, involving medical and non-medical staff in health promotion communication, devising action plans for health promotion policies and projects, and measuring health outcomes and impact for staff, patients, and the community, citation needed. The International Network of Health Promoting Hospitals and Health Services is the official, international network for the promotion and dissemination of principles, standards, and recommendations for health promotion in the hospital and health services settings, citation needed. Workplace setting. Main article, Workplace Health Promotion. The process of health promotion works in all settings and sectors where people live, work, play and love. A common setting is the workplace. The focus of health on the work site is that of prevention and the intervention that reduces the health risks of the employee. The U.S. Public Health Service recently, issued a report titled Physical Activity in Health, a report of the Surgeon General which provides a comprehensive review of the available scientific evidence about the relationship between physical activity and an individual's health status. The report shows that over 60% of Americans are not regularly active and that 25% are not active at all. There is very strong evidence linking physical activity to numerous health improvements. Health promotion can be performed in various locations. Among the settings that have received special attention are the community, healthcare facilities, schools, and worksites. 16. Worksite health promotion, also known by terms such as workplace health promotion, has been defined as the combined efforts of employers, employees, and society to improve the health and well-being of people at work. 17. 18. Who states that the workplace has been established as one of the priority settings for health promotion into the 21st century because it influences physical, mental, economic and social well-being and offers an ideal setting and infrastructure to support the promotion of health of a large audience. 19. Worksite health promotion programs, also called workplace health promotion programs, worksite wellness programs, or workplace wellness programs, include exercise, nutrition, smoking cessation, and stress management. Citation needed. According to the Centers for Disease Control and Prevention, CDC, regular physical activity is one of the most effective disease prevention behaviors. 20. Physical activity programs reduce feelings of anxiety and depression, reduce obesity, especially when combined with an improved diet, reduce risk of chronic diseases including cardiovascular disease, high blood pressure, and type 2 diabetes, and finally improve stamina, strength, and energy. Citation needed. Reviews and meta-analyses published between 2005 and 2008 that examined the scientific literature on worksite health promotion programs include the following. A review of 13 studies published through January 2004 showed strong evidence for an effect on dietary intake, inconclusive evidence for an effect on physical activity, and no evidence for an effect on health risk indicators. 21. In the most recent of a series of updates to a review of comprehensive health promotion and disease management programs at the worksite, Pelletier, 2005, noted positive clinical and cost outcomes but also found declines in the number of relevant studies and their quality. 22. A meta-evaluation of 56 studies published 1982 to 2005 found that worksite health promotion produced on average a decrease of 26.8% in sick leave absenteeism, a decrease of 26.1% in health costs, a decrease of 32% in workers' compensation costs and disability management claims costs, and a cost-benefit ratio of 5.81. 23. A meta-analysis of 46 studies published in 1970 to 2005 found moderate, statistically significant effects of work health promotion, especially exercise, on work ability and overall well-being. Further, a study conducted by the World Health Organization and the International Labour Organization found that exposure to long working hours is the occupational risk factor with the largest attributable burden of disease, i.e. an estimated 745,000 fatalities from ischemic heart disease and stroke events in 2016. 27. This landmark study established a new global policy argument and agenda for health promotion on psychosocial risk factors, including psychosocial stress, in the workplace setting. Entities and projects by country. Worldwide, government agencies, such as health departments, and non-governmental organizations have substantial efforts in the area of health promotion. Citation needed. Some of these entities and projects are international and multinational. The WHO and its regional offices such as the Pan American Health Organization are influential in health promotion around the world. 28. The main 8 health promotion campaigns marked by WHO are World Health Day, World Tuberculosis Day, World Blood Donor Day, World Immunization Week, World Malaria Day, World No Tobacco Day, World Hepatitis Day and World AIDS Day. 29. The WHO also reviews and endorses terminology including the Health Promotion Glossary 2021. The International Union for Health Promotion and Education, based in France, holds international, regional, and national conferences. 30. 31. The European Union is co-funding a joint action on chronic diseases and healthy aging across the life cycle, JA CRODIS, with a strong focus on health promotion. 32. Australia. The Australian Health Promotion Association, a professional body, was incorporated in the year 1988. 33. In November 2008, the National Health and Hospitals Reform Commission released a paper recommending a National Health Promotion Agency. 34. ACT Health of the Australian Capital Territory supports health promotion with funding and information dissemination. 35. The Victorian Health Promotion Foundation, Vic Health, from the state of Victoria is the world's first health promotion foundation to be funded by a tax on tobacco. 36. The Australian government has come up with some initiatives to help Australians achieve a healthy lifestyle. 37. These initiatives are Get Set for Life, Habits for Healthy Kids. 38. The Stephanie Alexander Kitchen Garden National Program. 39. 40. Healthy Spaces and Places. 41. Learning from Successful Community Obesity Initiative. Healthy Weight Information and Resources. Health promotion is strong and well established in Australia. Since 2008 there has been a number of graduate courses people can take to be involved within health promotion in Australia. The government since 2008 has included an initiative that involves the Aboriginal and Torres Strait Island citizens in the preventive health sector. 42. Health promotion in Australian schools. School programs are based on curriculum documents from state and territorial councils. Schools mainly focus on health issues that are being supported by funding in special events. Funding for many health issues are the main basis for the school curriculum's subject of health. 43. Health promotion for Aboriginal and Torres Strait Islander citizens. Aboriginal and Torres Strait Island citizens in Australia in the last couple of centuries have had poor health. The reason behind the poor health conditions is due to major events in the history of Australia. There is an increasing advancement in the promotion of health for Torres Strait Islander and Aboriginal citizens, but this cannot be achieved without the cooperation of non-Indigenous Australians. For this health promotion to be a success, the citizens of Australia need to put the history between non-Indigenous and Indigenous citizens behind them and cooperate as equals. 44. Canada. The province of Ontario appointed a health promotion minister to lead its Ministry of Health Promotion in the year of 2005. 45. The ministry's vision is to enable Ontarians to lead healthy, active lives and make the province a healthy, prosperous place to live, work, play, learn and visit. Ministry of Health Promotion sees that its fundamental goals are to promote and encourage Ontarians to make healthier choices at all ages and stages of life, to create healthy and supportive environments, lead the development of healthy public policy, and assist with embedding behaviors that promote health. 46. The Canadian Health Network was a reliable, non-commercial source of online information about how to stay healthy and prevent disease that was discontinued in 2007. 47. The BC Coalition for Health Promotion is a grassroots, voluntary non-profit society dedicated to the advancement of health promotion in British Columbia. 48. Denmark. The Unit for Health Promotion Research has main focus points around the WHO Ottawa Charter. Research is one main focus and works to strengthen health within communities, enhance environments that support health and help individuals develop the skills they need to maintain health. Staff within the program with both bachelor's and master's in public health, as well as other expertise such as psychology, anthropology, biology, epidemiology, environmental health and more, helps add to the teaching experience. Having a diverse staff means increased knowledge in diverse communities as well as increased communication throughout varying socioeconomic groups. With the wide range of research, teaching, and a diverse staff, the goal of health promotion can be achieved more seamlessly. Citation needed. India. Sanitation was a key focus on health promotion in India. The National Urban Sanitation Policy 2008 was a development that promoted sanitation in urban areas of the country which focused on improving sanitation in community-based organizations such as schools and open markets and to overall eliminate the practice of open defecation. 49. Ireland. Health promotion research in Ireland. The Health Promotion Research Centre, HPRC, at the National University of Ireland Galway was established in 1990 with support from the Department of Health to conduct health promotion-related research on issues relevant to health promotion in an Irish context. The centre is unique in that it is the only designated research centre in Ireland dedicated to health promotion. It produces high-quality research of national and international significance that supports the development of best practice and policy in the promotion of health. The center is a World Health Organization, WHO, collaborating center for health promotion research, has an active multidisciplinary research program, and collaborates with regional, national and international agencies on the development and evaluation of health promotion interventions and strategies. Citation needed. Objectives of the HPRC include the generation and dissemination of health promotion research that is of national and international relevance. The translation of research that will lead to the development of healthy public policy and evidence-informed practice. In 1997, another professional association was created, the Association for Health Promotion Ireland, AHPI. The AHPI operates independent of employers' organizations and works to create opportunities for members to network and to provide them with support. The AHPI is particularly for those who work within or are interested in health promotion, and is the only professional organization that operates as such in Ireland. New Zealand. The Health Promotion Forum, HPF, of New Zealand is the national umbrella organization of over 150 organizations committed to improving health. 50. 51. HPF has worked with the Cancer Society in order to produce a personal development plan for health promoters, which may be helpful to perform personal development reviews, to identify the competencies of individuals and to provide ideas for future development. 52. The Health Promotion Agency, HPA, formed July 1, 2012, is a Crown agency established under the New Zealand Public Health and Disability Amendment Act 2012. 53. Its board has been appointed by the Minister of Health. 54. The work of HPA is divided into three main areas: promoting the well-being and health of the community, enabling health-promoting initiatives and environments, informing the public on health-promoting policies and practices. 55. HPA has a variety of programs based around many areas of work, including alcohol, immunization, mental health, and skin cancer prevention. The agency aims to promote the well-being of individuals and encourage healthy lifestyles, prevent disease, illness and injury, enable environments that support health and well-being, and to reduce personal, economic and social harm. 56. Health Workforce New Zealand, HWNZ, is an organization that is part of the National Health Board which provides national leadership on the development of the health workforce. 57. Some health promotional programs supported by HWNZ include education and training initiatives, and the Voluntary Bonding Scheme, which rewards medical, midwifery and nursing graduates who agree to work in hard-to-staff communities, and sonography, medical physicist and radiation therapy graduates who stay in New Zealand. 58. Health promotion in New Zealand has become an established approach in addressing public problems since the 1980s, through increasing use of intersectoral action, the use of public policy and mass media as promotional strategies, and the increasing control Maori have taken over the provision and purchase of health promotion services. 59. An example of health promotional initiatives is the action put in place to reduce childhood obesity in primary schools. Research was completed to identify the barriers to improving school food environments and promoting healthy nutrition in primary schools in New Zealand. 60. Considerable progress has also been made in the Health Impact Assessment, HIA, research on the impact of policies on health in New Zealand. The approach has an important contribution to make in the strengthening of health and well-being in policymaking in New Zealand. 61. Norway. In 2012, Norway created the Norwegian Public Health Act, PHA, in 2012. This act is based on policies of health equity, high AP, sustainable development, the precautionary principle, knowledge-based approaches, and civil society participation. There is a strong focus on promoting health on the local level by giving decision-making power to the counties in order to decrease inequalities and increase a fair distribution of resources across all populations. 62. Sri Lanka. In 2015, the life expectancy of Sri Lankan people was 72 for male and 78 for female. 63. The disease burden has started to shift towards non-communicable diseases related to lifestyle and environmental factors. 64. The 2012 estimated healthy life expectancy at birth of all Sri Lanka's population is 68 for females, 63 for males, and 65 overall. 65. The development of the Sri Lankan National Health Promotion Policy is related to the State Policy and Strategy for Health and the Health Master Plan 2007 to 2016. It emphasizes advocacy and empowerment to enable individuals and communities to take control of their own health, as well as improving the management of health promotion interventions across sectors. 66. Sweden. In Sweden, on a national level, health promotion is primarily the responsibility of the Public Health Agency of Sweden. 67. However, many regional initiatives exist, for example, within clinical health promotion programs in certain geographical areas. 68. Health promotion is also highlighted by the Swedish National Board of Health and Welfare, as the agency suggests this to be a component in health professionals' curriculum and training, which concerns, for example, registered nurses and physicians. 69. Many health promotion initiatives in Sweden focus on health equity and thus focus on groups in society that have seemed to be experiencing poorer health status. For example, a Swedish study suggests that health promotion interventions aiming at empowering adolescents in disadvantaged communities should enable active learning activities, use visualizing tools to facilitate self-reflection, and allow the adolescents to influence the intervention activities. Health promotion in schools has grown because of the link between student health and well-being, so in order to help with their mental and physical health, health promotion has grown in school settings. 70. United Kingdom. The Royal Society for Public Health was formed in October 2008 by the merger of the Royal Society for the Promotion of Health, also known as the Royal Society of Health or RSH, and the Royal Institute of Public Health, RIPH. 71. Earlier, July 2005 saw the publication by the Department of Health and Welsh Assembly Government of Shaping the Future of Public Health, Promoting Health in the NHS, citation needed, following discussions with the Department of Health and Welsh Assembly Government. Officials, the Royal Society for Public Health and 3 national public health bodies agreed, in 2006, to work together to take forward the report's recommendations, working in partnership with other organizations. 72. Accordingly, the Royal Society for Public Health, RSPH, leads and hosts the collaboration, and focuses on advocacy for health promotion and its workforce. The Institute of Health Promotion and Education, IHPE, works with the RSPH Royal Society for Public Health to give a voice to the workforce. The Faculty of Public Health, FPH, focuses on professional standards, education and training, and the UK Public Health Register, UKPHR, is responsible for the regulation of the workforce. In Northern Ireland, the government's Health Promotion Agency for Northern Ireland was set up to provide leadership, strategic direction and support, where possible, to all those involved in promoting health in Northern Ireland. The Health Promotion Agency for Northern Ireland was incorporated into the Public Health Agency for Northern Ireland in April 2009. 73. Recent work in the UK, Delphi consultation exercise due to be published late 2009 by Royal Society of Public Health and the National Social Marketing Centre, on the relationship between health promotion and social marketing has highlighted and reinforced the potential integrative nature of the approaches. While an independent review, NCC It's Our Health, 2006, identified that some social marketing has in the past adopted a narrow or limited approach, the UK has increasingly taken a lead in the discussion and developed a much more integrative and strategic approach. 74. This development adopts a holistic approach, integrating the learning from effective health promotion approaches with relevant learning from social marketing and other disciplines. A key finding from the Delphi consultation was the need to avoid unnecessary and arbitrary methods wars and instead focus on the issue of utility and harnessing the potential of learning from multiple disciplines and sources. Such an approach is arguably how health promotion has developed. United States. In the United States, one of the Ottawa Charter health promotion actions, developing personal skills, is the core of health education, and quite often health education is confused for the whole of health promotion. Government agencies in the U.S. concerned with health promotion include the following. The Centers for Disease Control and Prevention has a coordinating center for health promotion whose mission is to prevent disease, improve health, and enhance human potential through evidence-based interventions and research in maternal and child health, chronic disease, disabilities, genomics, and hereditary disorders. 75, 76. The National Institute for Occupational Safety and Health has developed Total Worker Health, a strategy incorporating elements of occupational safety and health promotion, to advance the health and well-being of employees. 77, 78. The United States Army Center for Health Promotion and Preventive Medicine provides worldwide technical support for implementing preventive medicine, public health, and health promotion/wellness services into all aspects of America's Army and the Army community. 79. Non-governmental organizations in the U.S. concerned with health promotion include the Public Health Education and Health Promotion section is an active component of the American Public Health Association, 80. The National Commission for Health Education Credentialing offers the Certified Health Education Specialist and Master Certified Health Education Specialist examination, a competency-based tool used to measure possession, application, and interpretation of knowledge in the 7 areas of responsibility for health education specialists. The exam reflects the entry-level subcompetencies of these areas of responsibility. In the 2020 Health Education and Promotion Terminology Report document, health promotion is defined by Green and Kreuter as any planned combination of educational, political, regulatory, or organizational supports for actions and conditions of living conducive to the health of individuals, groups, and communities. 81. This is an activity-based definition rather than the process-based definition from the foundational WHO Ottawa Charter for Health Promotion, 1986, and dominate in everywhere except the U.S. The Wellness Council of America is an industry trade group that supports workplace health promotion programs. 82, 83. URAC, Utilization Review Accreditation Commission, accredits comprehensive wellness programs that focus on health promotion, chronic disease prevention and health risk reduction. 84. See also. Breastfeeding promotion. Health 21. Health for all. Health marketing. Health policy. Health promoting hospitals. Health promotion in higher education. Preventive healthcare. Right to health. In common usage in medicine, health, according to the World Health Organization, is a state of complete physical, mental, and social well-being and not merely the absence of disease and infirmity. 1. A variety of definitions have been used for different purposes over time. Health can be promoted by encouraging healthful activities, such as regular physical exercise and adequate sleep. 2. And by reducing or avoiding unhealthful activities or situations, such as smoking or excessive stress. Some factors affecting health are due to individual choices, such as whether to engage in a high-risk behavior, while others are due to structural causes, such as whether the society is arranged in a way that makes it easier or harder for people to get necessary healthcare services. Still, other factors are beyond both individual and group choices, such as genetic disorders. History. The meaning of health has evolved over time. In keeping with the biomedical perspective, early definitions of health focused on the theme of the body's ability to function. Health was seen as a state of normal function that could be disrupted from time to time by disease. An example of such a definition of health is a state characterized by anatomic, physiologic, and psychological integrity, ability to perform personally valued family, work, and community roles, ability to deal with physical, biological, psychological, and social stress. 3. Then, in 1948, in a radical departure from previous definitions, the World Health Organization, WHO, proposed a definition that aimed higher, linking health to well-being, in terms of physical, mental, and social well-being, and not merely the absence of disease and infirmity. 4. Although this definition was welcomed by some as being innovative, it was also criticized for being vague and excessively broad and was not construed as measurable. For a long time, it was set aside as an impractical ideal, with most discussions of health returning to the practicality of the biomedical model. 5. Just as there was a shift from viewing disease as a state to thinking of it as a process, the same shift happened in definitions of health. Again, the WHO played a leading role when it fostered the development of the health promotion movement in the 1980s. This brought in a new conception of health, not as a state, but in dynamic terms of resiliency, in other words, as a resource for living. In 1984, WHO revised the definition of health, defined it as the extent to which an individual or group is able to realize aspirations and satisfy needs and to change or cope with the environment. Health is a resource for everyday life, not the objective of living. It is a positive concept, emphasizing social and personal resources, as well as physical capacities. 6. Thus, health referred to the ability to maintain homeostasis and recover from adverse events. Mental, intellectual, emotional, and social health referred to a person's ability to handle stress, to acquire skills, to maintain relationships, all of which form resources for resiliency and independent living. 5. This opens up many possibilities for health to be taught, strengthened, and learned. Since the late 1970s, the Federal Healthy People Program has been a visible component of the United States approach to improving population health. 7. In each decade, a new version of Healthy People is issued. 8. Featuring updated goals and identifying topic areas and quantifiable objectives for health improvement during the succeeding 10 years, with assessment at that point of progress or lack thereof. Progress has been limited to many objectives, leading to concerns about the effectiveness of Healthy People in shaping outcomes in the context of a decentralized and uncoordinated U.S. health system. Healthy People 2020 gives more prominence to health promotion and preventive approaches and adds a substantive focus on the importance of addressing social determinants of health. A new expanded digital interface facilitates use and dissemination rather than bulky printed books as produced in the past. The impact of these changes to Healthy People will be determined in the coming years. 9. Systematic activities to prevent or cure health problems and promote good health in humans are undertaken by healthcare providers. Applications with regard to animal health are covered by the veterinary sciences. The term healthy is also widely used in the context of many types of non-living organizations and their impacts for the benefit of humans, such as in the sense of healthy communities, healthy cities, or healthy environments. In addition to healthcare interventions and a person's surroundings, a number of other factors are known to influence the health status of individuals. These are referred to as the determinants of health, which include the individual's background, lifestyle, economic status, social conditions, and spirituality. Studies have shown that high levels of stress can determinants. See also, social determinants of health and risk factor. In general, the context in which an individual lives is of great importance for both his health status and quality of life. It is increasingly recognized that health is maintained and improved not only through the advancement and application of health science, but also through the efforts and intelligent lifestyle choices of the individual and society. According to the World Health Organization, the main determinants of health include the social and economic environment, the physical environment, and the person's individual characteristics and behaviors. 13. More specifically, key factors that have been found to influence whether people are healthy or unhealthy include the following: frowny face 13, 14, 15. Education and literacy. Employment/working conditions. Income and social status. Physical environments. Social environments. Social support networks. Biology and genetics. Culture. Gender. Healthcare services. Healthy child development. Personal health practices and coping skills. Donald Henderson as part of the CDC smallpox eradication team in 1966. An increasing number of studies and reports from different organizations and contexts examine the linkages between health and different factors, including lifestyles, environments, healthcare organization, and health policy. One specific health policy brought into many countries in recent years was the introduction of the sugar tax. Beverage taxes came into light with increasing concerns about obesity, particularly among youth. Sugar-sweetened beverages have become a target of anti-obesity initiatives with increasing evidence of their link to obesity. 16, such as the 1974 Lalonde report from Canada Wink with a Frown 15, the Alameda County study in California Wink with a Frown 17, and the series of World Health reports of the World Health Organization, which focuses on global health issues including access to health care and improving public health outcomes, especially in developing countries. 18. The concept of the health field, as distinct from medical care, emerged from the Lalonde report from Canada. The report identified 3 interdependent fields as key determinants of an individual's health. These are frowny face 15. Biomedical, all aspects of health, physical and mental, developed within the human body as influenced by genetic makeup. Environmental, all matters related to health external to the human body and over which the individual has little or no control. Lifestyle, the aggregation of personal decisions, i.e., over which the individual has control, that can be said to contribute to, or cause, illness or death. The maintenance and promotion of health is achieved through different combination of physical, mental, and social well-being, a combination sometimes referred to as the health triangle. 19. The WHO's 1986 Ottawa Charter for Health Promotion further stated that health is not just a state, but also a resource for everyday life, not the objective of living. Health is a positive concept emphasizing social and personal resources, as well as physical capacities. 20. Focusing more on lifestyle issues and their relationships with functional health. Data from the Alameda County study suggested that people can improve their health via exercise, enough sleep, spending time in nature, maintaining a healthy body weight, limiting alcohol use, and avoiding smoking. 21. Health and illness can coexist, as even people with multiple chronic diseases or terminal illnesses can consider themselves healthy. 22. If you want to learn about the health of a population, look at the air they breathe, the water they drink, and the places where they live. 23. 24. Hippocrates, the father of medicine, 5th century BC. The environment is often cited as an important factor influencing the health status of individuals. This includes characteristics of the natural environment, the built environment, and the social environment. Factors such as clean water and air, adequate housing, and safe communities and roads all have been found to contribute to good health, especially to the health of infants and children. 13. 25. Some studies have shown that a lack of neighborhood recreational spaces including natural environment leads to lower levels of personal satisfaction and higher levels of obesity, linked to lower overall health and well-being. 26. It has been demonstrated that increased time spent in natural environments is associated with improved self-reported health, 27, suggesting that the positive health benefits of natural space in urban neighborhoods should be taken into account in public policy and land use. Genetics, or inherited traits from parents, also play a role in determining the health status of individuals and populations. This can encompass both the predisposition to certain diseases and health conditions, as well as the habits and behaviors individuals develop through the lifestyle of their families. For example, genetics may play a role in the potential issues. A number of health issues are common around the globe. Disease is one of the most common. According to globalissues.org, approximately 36 million people die each year from non-communicable, i.e., not contagious, diseases, including cardiovascular disease, cancer, diabetes, and chronic lung disease. 29. Among communicable diseases, both viral and bacterial, AIDS/HIV, tuberculosis, and malaria are the most common, causing millions of deaths every year. 29. Another health issue that causes death or contributes to other health problems is malnutrition, especially among children. One of the groups malnutrition affects most is young children. Approximately 7.5 million children under the age of 5 die from malnutrition, usually brought on by not having the money to find or make food. 29. Bodily injuries are also a common health issue worldwide. These injuries, including bone fractures and burns, can reduce a person's quality of life or can cause fatalities, including infections that resulted from the injury, or the severity injury in general. 29. Lifestyle choices are contributing factors to poor health in many cases. These include smoking cigarettes, and can also include a poor diet, whether it is overeating or an overly constrictive diet. Inactivity can also contribute to health issues, and also a lack of sleep, excessive alcohol consumption, and neglect of oral hygiene. Citation needed. There are also genetic disorders that are inherited by the person and can vary in how much they affect the person, and when they surface. Citation needed. Although the majority of these health issues are preventable, a major contributor to global ill health is the fact that approximately 1 billion people lack access to healthcare systems. 29. Arguably, the most common and harmful health issue is that a great many people do not have access to quality remedies. 30. Mental health. Main article, Mental health. The World Health Organization describes mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. 31. Mental health is not just the absence of mental illness. 32. Mental illness is described as the spectrum of cognitive, emotional, and behavioral conditions that interfere with social and emotional well-being and the lives and productivity of people. Having a mental illness can seriously impair, temporarily or permanently, the mental functioning of a person. Other terms include mental health problem, illness, disorder, dysfunction. 33. Approximately 20% of all adults in the U.S. are considered diagnosable with a mental illness. Mental illnesses are the leading cause of disability in the United States and Canada. Examples of these illnesses include schizophrenia, ADHD, major depressive disorder, bipolar disorder, anxiety disorder, post-traumatic stress disorder, and autism. 34. Many factors contribute to mental health problems, including frowny face. 35. Biological factors, such as genes or brain chemistry. Family history of mental health problems. Life experiences, such as trauma or abuse. Achieving and maintaining health is an ongoing process, shaped by both the evolution of healthcare knowledge and practices as well as personal strategies and organized interventions for staying healthy. Diet. Main articles, Healthy diet and human nutrition. See also, List of nutrition guides. Percentage of overweight or obese population in 2010. Data source, OECD's iLibrary, 36, 37. Percentage of obese population in 2010. Data source, OECD's iLibrary, 36, 38. An important way to maintain one's personal health is to have a healthy diet. A healthy diet includes a variety of plant-based and animal-based foods that provide nutrients to the body. Such nutrients provide the body with energy and keep it running. Nutrients help build and strengthen bones, muscles, and tendons and also regulate body processes, i.e., blood pressure. Water is essential for growth, reproduction, and good health. Macronutrients are consumed in relatively large quantities and include proteins, carbohydrates, and fats and fatty acids. Micronutrients, vitamins and minerals, are consumed in relatively smaller quantities, but are essential to body processes. 39. The food guide pyramid is a pyramid-shaped guide of healthy foods divided into sections. Each section shows the recommended intake for each food group, i.e., protein, fat, carbohydrates and sugars. Making healthy food choices can lower one's risk of heart disease and the risk of developing some types of cancer, and can help one maintain their weight within a healthy range. 40. The Mediterranean diet is commonly associated with health-promoting effects. This is sometimes attributed to the inclusion of bioactive compounds such as phenolic compounds, isoprenoids and alkaloids. 41. Exercise. Main article, Exercise. Physical exercise enhances or maintains physical fitness and overall health and wellness. It strengthens one's bones and muscles and improves the cardiovascular system. According to the National Institutes of Health, there are 4 types of exercise: endurance, strength, flexibility, and balance. 42. The CDC states that physical exercise can reduce the risks of heart disease, cancer, type 2 diabetes, high blood pressure, obesity, depression, and anxiety. 43. For the purpose of counteracting possible risks, it is often recommended to start physical exercise gradually as one goes. Participating in any exercising, whether it is housework, yard work, walking or standing up when talking on the phone, is often thought to be better than none when it comes to health. 44. Sleep. Main articles, Sleep and sleep deprivation. Sleep is an essential component to maintaining health. In children, sleep is also vital for growth and development. Ongoing sleep deprivation has been linked to an increased risk for some chronic health problems. In addition, sleep deprivation has been shown to correlate with both increased susceptibility to illness and slower recovery times from illness. 45. In one study, people with chronic insufficient sleep, set as 6 hours of sleep a night or less, were found to be 4 times more likely to catch a cold compared to those who reported sleeping for 7 hours or more a night. 46. Due to the role of sleep in regulating metabolism, insufficient sleep may also play a role in weight gain or, conversely, in impeding weight loss. 47. Additionally, in 2007, the International Agency for Research on Cancer, which is the cancer research agency for the World Health Organization, declared that shift work that involves circadian disruption is probably carcinogenic to humans, speaking to the dangers of long-term nighttime work due to its intrusion on sleep. 48. In 2015, the National Sleep Foundation released updated recommendations for sleep duration requirements based on age and concluded that individuals who habitually sleep outside the normal range may be exhibiting signs or symptoms of serious health problems or, if done volitionally, may be compromising their health and well-being. 49. Age and condition sleep needs. Newborns, 0 to 3 months, 14 to 17 hours. Infants, 4 to 11 months, 12 to 15 hours. Toddlers, 1 to 2 years, 11 to 14 hours. Preschoolers, 3 to 5 years, 10 to 13 hours. School-age children, 6 to 13 years, 9 to 11 hours. Teenagers, 14 to 17 years, 8 to 10 hours. Adults, 18 to 64 years, 7 to 9 hours. Older adults, 65 years and over, 7 to 8 hours. Role of science. Main articles, Health Science and Health Care. 149. The Dutch Public Health Service provides medical care for the natives of the Dutch East Indies, May 1946. Health science is the branch of science focused on health. There are 2 main approaches to health science: the study and research of the body and health-related issues to understand how humans and animals function, and the application of that knowledge to improve health and to prevent and cure diseases and other physical and mental impairments. The science builds on many subfields, including biology, biochemistry, physics, epidemiology, pharmacology, medical sociology. Applied health sciences endeavor to better understand and improve human health through applications in areas such as health education, biomedical engineering, biotechnology, and public health. Organized interventions to improve health based on the principles and procedures developed through the health sciences are provided by practitioners trained in medicine, nursing, nutrition, pharmacy, social work, psychology, occupational therapy, physical therapy, and other health care professions. Clinical practitioners focus mainly on the health of individuals, while public health practitioners consider the overall health of communities and populations. Workplace wellness programs are increasingly being adopted by companies for their value in improving the health and well-being of their employees, as are school health services to improve the health and well-being of children. Role of medicine and medical science. Main article, Medicine. Contemporary medicine is in general conducted within healthcare systems. Legal, credentialing and financing frameworks are established by individual governments, augmented on occasion by international organizations, such as churches. The characteristics of any given healthcare system have significant impact on the way medical care is provided. From ancient times, Christian emphasis on practical charity gave rise to the development of systematic nursing and hospitals, and the Catholic Church today remains the largest non-government provider of medical services in the world. 50 advanced industrial countries, with the exception of the United States, 51, and many developing countries provide medical services through a system of universal health care that aims to guarantee care for all through a single-payer healthcare system or compulsory private or cooperative health insurance. This is intended to ensure that the entire population has access to medical care on the basis of need rather than ability to pay. Delivery may be via private medical practices or by state-owned hospitals and clinics, or by charities, most commonly by a combination of all three. Most tribal societies provide no guarantee of healthcare for the population as a whole. In such societies, healthcare is available to those that can afford to pay for it or have self-insured it, either directly or as part of an employment contract, or who may be covered by care financed by the government or tribe directly. Collection of glass bottles of different sizes. Modern drug ampoules. Transparency of information is another factor defining a delivery system. Access to information on conditions, treatments, quality, and pricing greatly affects the choice by patients/consumers and, therefore, the incentives of medical professionals. While the U.S. healthcare system has come under fire for lack of openness, 52, new legislation may encourage greater openness. There is a perceived tension between the need for transparency on the one hand and such issues as patient confidentiality and the possible exploitation of information for commercial gain on the other. Delivery. See also, health care, clinic, hospital, and hospice. Provision of medical care is classified into primary, secondary, and tertiary care categories. 53. Photograph of 3 nurses. Nurses in Kokopo, East New Britain, Papua New Guinea. Primary care medical services are provided by physicians, physician assistants, nurse practitioners, or other health professionals who have first contact with a patient seeking medical treatment or care. 54. These occur in physician offices, clinics, nursing homes, schools, home visits, and other places close to patients. About 90% of medical visits can be treated by the primary care provider. These include treatment of acute and chronic illnesses, preventive care and health education for all ages and both sexes. Secondary care medical services are provided by medical specialists in their offices or clinics or at local community hospitals for a patient referred by a primary care provider who first diagnosed or treated the patient. 55. Referrals are made for those patients who required the expertise or procedures performed by specialists. These include both ambulatory care and inpatient services, emergency departments, intensive care medicine, surgery services, physical therapy, labor and delivery, endoscopy units, diagnostic laboratory and medical imaging services, hospice centers, etc. Some primary care providers may also take care of hospitalized patients and deliver babies in a secondary care setting. Tertiary care medical services are provided by specialist hospitals or regional centers equipped with diagnostic and treatment facilities not generally available at local hospitals. These include trauma centers, burn treatment centers, advanced neonatology unit services, organ transplants, high-risk pregnancy, radiation oncology, etc. Modern medical care also depends on information, still delivered in many healthcare settings on paper records, but increasingly nowadays by electronic means. In low-income countries, modern healthcare is often too expensive for the average person. International healthcare policy researchers have advocated that user fees be removed in these areas to ensure access, although even after removal, significant costs and barriers remain. 56. Separation of prescribing and dispensing is a practice in medicine and pharmacy in which the physician who provides a medical prescription is independent from the pharmacist who provides the prescription drug. In the Western world there are centuries of tradition for separating pharmacists from physicians. In Asian countries, it is traditional for physicians to also provide drugs. 57. Role of public health. Main article, Public Health. See also, Global Health. Postage stamp, New Zealand, 1933. Public health has been promoted, and depicted, in a wide variety of ways. Public health has been described as the science and art of preventing disease, prolonging life and promoting health through the organized efforts and informed choices of society, organizations, public and private, communities and individuals. 58. It is concerned with threats to the overall health of a community based on population health analysis. The population in question can be as small as a handful of people or as large as all the inhabitants of several continents, for instance, in the case of a pandemic. Public health has many subfields, but typically includes the interdisciplinary categories of epidemiology, biostatistics, and health services. Environmental health, community health, behavioral health, and occupational health are also important areas of public health. The focus of public health interventions is to prevent and manage diseases, injuries and other health conditions through surveillance of cases and the promotion of healthy behavior, communities, and, in aspects relevant to human health, environments. Its aim is to prevent health problems from happening or reoccurring by implementing educational programs, developing policies, administering services and conducting research. 59. In many cases, treating a disease or controlling a pathogen can be vital to preventing it in others, such as during an outbreak. Vaccination programs and distribution of condoms to prevent the spread of communicable diseases are examples of common preventive public health measures, as are educational campaigns to promote vaccination and the use of condoms, including overcoming resistance to such. Public health also takes various actions to limit the health disparities between different areas of the country and, in some cases, the continent or world. One issue is the access of individuals and communities to health care in terms of financial, geographical, or socio-cultural constraints. 60. Applications of the public health system include the areas of maternal and child health, health services administration, emergency response, and prevention and control of infectious and chronic diseases. The great positive impact of public health programs. Personal health depends partially on the active, passive, and assisted cues people observe and adopt about their own health. These include personal actions for preventing or minimizing the effects of a disease, usually a chronic condition, through integrative care. They also include personal hygiene practices to prevent infection and illness, such as bathing and washing hands with soap, brushing and flossing teeth, storing, preparing and handling food safely, and many others. The information gleaned from personal observations of daily living, such as about sleep patterns, exercise behavior, nutritional intake and environmental features, may be used to inform personal decisions and actions. Example, I feel tired in the morning so I am going to try sleeping on a different pillow, as well as clinical decisions and treatment plans. Example, a patient who notices his or her shoes are tighter than usual may be having exacerbation of left-sided heart failure, and may require diuretic medication to reduce fluid overload. 63. Personal health also depends partially on the social structure of a person's life. The maintenance of strong social relationships, volunteering, and other social activities have been linked to positive mental health and also increased longevity. One American study among seniors over age 70 found that frequent volunteering was associated with reduced risk of dying compared with older persons who did not volunteer, regardless of physical health status. 64. Another study from Singapore reported that volunteering retirees had significantly better cognitive performance scores, fewer depressive symptoms, and better mental well-being and life satisfaction than non-volunteering retirees. 65. Prolonged psychological stress may negatively impact health, and has been cited as a factor in cognitive impairment with aging, depressive illness, and expression of disease. 66. Stress management is the application of methods to either reduce stress or increase tolerance to stress. Relaxation techniques are physical methods used to relieve stress. Psychological methods include cognitive therapy, meditation, and positive thinking, which work by reducing response to stress. Improving relevant skills, such as problem-solving and time management skills, reduces uncertainty and builds confidence, which also reduces the reaction to stress-causing situations where those skills are applicable. Occupational. Main article, Occupational Safety and Health. In addition to safety risks, many jobs also present risks of disease, illness and other long-term health problems. Among the most common occupational diseases are various forms of pneumoconiosis, including silicosis and coal workers' pneumoconiosis, black lung disease. Asthma is another respiratory illness that many workers are vulnerable to. Workers may also be vulnerable to skin diseases, including eczema, dermatitis, urticaria, sunburn, and skin cancer. 67. Other occupational diseases of concern include carpal tunnel syndrome and lead poisoning. As the number of service sector jobs has risen in developed countries, more and more jobs have become sedentary, presenting a different array of health problems than those associated with manufacturing and the primary sector. Contemporary problems, such as the growing rate of obesity and issues relating to stress and overwork in many countries, have further complicated the interaction between work and health. Many governments view occupational health as a social challenge and have formed public organizations to ensure the health and safety of workers. Examples of these include the British Health and Safety Executive and in the United States, the National Institute for Occupational Safety and Health, which conducts research on occupational health and safety, and the Occupational Safety and Health Administration, which handles regulation and policy relating to worker safety and health. 68. See also: disease burden, impact of diseases. Environmental health, public health branch focused on environmental impacts on human health. Healing, process of the restoration of health. Health equity, study and causes of differences in the quality of health and healthcare. Human enhancement, natural, artificial, or technological alteration of the human body. List of health and wellness podcasts. Men's health, physical, mental, and social well-being, as experienced by men. One Health, collaborative global initiative to attain optimal health for people, animals, and the environment. Population health, health outcomes of a group of individuals. Women's health, broad subject that encompasses all facets of women's health. Youth health, range of approaches to preventing, detecting, or treating young people's health risks and issues. Health care, or healthcare, is the improvement of health via the prevention, diagnosis, treatment, amelioration, or cure of disease, illness, injury, and other physical and mental impairments in people. Health care is delivered by health professionals and allied health fields. Medicine, dentistry, pharmacy, midwifery, nursing, optometry, audiology, psychology, occupational therapy, physical therapy, athletic training, and other health professions all constitute health care. It includes work done in providing primary care, secondary care, and tertiary care, as well as in public health. Access to healthcare may vary across countries, communities, and individuals, influenced by social and economic conditions as well as health policies. Providing health care services means the timely use of personal health services to achieve the best possible health outcomes. 3. Factors to consider in terms of healthcare access include financial limitations, such as insurance coverage, geographical and logistical barriers, such as additional transportation costs and the ability to take paid time off work to use such services, socio-cultural expectations, and personal limitations, lack of ability to communicate with healthcare providers. Poor health literacy, low income. 4. Limitations to healthcare services affects negatively the use of medical services, the efficacy of treatments, and overall outcome, well-being, mortality rates. Health systems are organizations established to meet the health needs of targeted populations. According to the World Health Organization, WHO, a well-functioning healthcare system requires a financing mechanism, a well-trained and adequately paid workforce, reliable information on which to base decisions and policies, and well-maintained health facilities to deliver quality medicines and technologies. An efficient healthcare system can contribute to a significant part of a country's economy, development, and industrialization. Healthcare is conventionally regarded as an important determinant in promoting the general physical and mental health and well-being of people around the world. 5. An example of this was the worldwide eradication of smallpox in 1980, declared by the WHO as the first disease in human history to be eliminated by deliberate healthcare interventions. 6. Delivery. See also: health professionals. Primary care may be provided in community health centers. The delivery of modern health care depends on groups of trained professionals and paraprofessionals coming together as interdisciplinary teams. 7. This includes professionals in medicine, psychology, physiotherapy, nursing, dentistry, midwifery and allied health, along with many others such as public health practitioners, community health workers and assistive personnel, who systematically provide personal and population-based preventive, curative and rehabilitative care services, citation. Needed. While the definitions of the various types of healthcare vary depending on the different cultural, political, organizational, and disciplinary perspectives, there appears to be some consensus that primary care constitutes the first element of a continuing healthcare process and may also include the provision of secondary and tertiary levels of care. 8. Healthcare can be defined as either public or private. Citation needed. Primary care. Main article, Primary care. See also, primary health care, ambulatory care, and urgent care. Hospital-trained therapist Matvey Mudrov in Khabarovsk, Russia. 9. Primary care refers to the work of health professionals who act as a first point of consultation for all patients within the healthcare system. 8. 10. Such a professional would usually be a primary care physician, such as a general practitioner or family physician. Another professional would be a licensed independent practitioner such as a physiotherapist, or a non-physician primary care provider such as a physician assistant or nurse practitioner. Depending on the locality and health system organization, the patient may see another healthcare professional first, such as a pharmacist or nurse. Depending on the nature of the health condition, patients may be referred for secondary or tertiary care. Citation needed. Primary care is frequently denoted as the healthcare services which is integral to the local community. It can be provided in different settings, such as urgent care centers that provide same-day appointments or services on a walk-in basis. Primary care involves the widest scope of health care, including all ages of patients, patients of all socioeconomic and geographic origins, patients seeking to maintain optimal health, and patients with all types of acute and chronic physical, mental, and social health issues, including multiple chronic diseases. Consequently, a primary care practitioner must possess a wide breadth of knowledge in many areas. Continuity is a key characteristic of primary care, as patients usually prefer to consult the same practitioner for routine checkups and preventive care, health education, and every time they require an initial consultation about a new health problem. The International Classification of Primary Care, ICPC, is a standardized tool for understanding and analyzing information on interventions in primary care based on the reason for the patient's visit. 11. Common chronic illnesses usually treated in primary care may include, for example, hypertension, diabetes, asthma, COPD, depression and anxiety, back pain, arthritis or thyroid dysfunction. Primary care also includes many basic maternal and child health care services, such as family planning services and vaccinations. In the United States, the 2013 National Health Interview Survey found that skin disorders, 42.7%, osteoarthritis and joint disorders, 33.6%, back problems, 23.9%, disorders of lipid metabolism, 22.4%, and upper respiratory tract disease, 22.1%, excluding asthma, were the most common reasons for accessing a physician. 12. In the United States, primary care physicians have begun to deliver primary care outside of the managed care, insurance billing, system through direct primary care, which is a subset of the more familiar concierge medicine. Physicians in this model bill patients directly for services, either on a prepaid monthly, quarterly, or annual basis, or bill for each service in the office. Examples of direct primary care practices include Foundation Health in Colorado and clients in Washington. In the context of global population aging, with increasing numbers of older adults at greater risk of chronic non-communicable diseases, rapidly increasing demand for primary care services is expected in both developed and developing countries. 13. 14. The World Health Organization attributes the provision of essential primary care as an integral component of an inclusive primary health care strategy. 8. Secondary care. Jackson Memorial Hospital in Miami, the primary teaching hospital of the University of Miami's Leonard M. Miller School of Medicine and the largest hospital in the United States with 1,547 beds. 15. Secondary care includes acute care, necessary treatment for a short period of time for a brief but serious illness, injury, or other health condition. This care is often found in a hospital emergency department. Secondary care also includes skilled attendance during childbirth, intensive care, and medical imaging services. 16. The term secondary care is sometimes used synonymously with hospital care. However, many secondary care providers, such as psychiatrists, clinical psychologists, occupational therapists, most dental specialties or physiotherapists, do not necessarily work in hospitals. Some primary care services are delivered within hospitals. Depending on the organization and policies of the national health system, patients may be required to see a primary care provider for a referral before they can access secondary care. 17-18. In countries that operate under a mixed market healthcare system, some physicians limit their practice to secondary care by requiring patients to see a primary care provider first. This restriction may be imposed under the terms of the payment agreements in private or group health insurance plans. In other cases, medical specialists may see patients without a referral. Tertiary care. National Hospital for Neurology and Neurosurgery in London, United Kingdom is a specialist neurological hospital. Tertiary care is specialized consultative health care, usually for inpatients and on referral from a primary or secondary health professional, in a facility that has personnel and facilities for advanced medical investigation and treatment, such as a tertiary referral hospital. 19. Examples of tertiary care services are cancer management, neurosurgery, cardiac surgery, plastic surgery, treatment for severe burns, advanced neonatology services, palliative, and other complex medical and surgical interventions. 20. Quaternary care. The term quaternary care is sometimes used as an extension of tertiary care in reference to advanced levels of medicine which are highly specialized and not widely accessed. Experimental medicine and some types of uncommon diagnostic or surgical procedures are considered quaternary care. These services are usually only offered in a limited number of regional or national healthcare centers. 20-21. Home and community care. See also, public health. Many types of healthcare interventions are delivered outside of health facilities. They include many interventions of public health interest, such as food safety surveillance, distribution of condoms and needle exchange programs for the prevention of transmissible diseases. They also include the services of professionals in residential and community settings in support of self-care, home care, long-term care, assisted living, treatment for substance use disorders among other types of health and social care services. Community rehabilitation services can assist with mobility and independence after the loss of limbs or loss of function. This can include prostheses, orthotics, or wheelchairs. Many countries are dealing with aging populations, so one of the priorities of the healthcare system is to help seniors live full, independent lives in the comfort of their own homes. There is an entire section of healthcare geared to providing seniors with help in day-to-day activities at home such as transportation to and from doctor's appointments along with many other activities that are essential for their health and well-being. Although they provide home care for older adults in cooperation, family members and care workers may harbor diverging attitudes and values towards their joint efforts. This state of affairs presents a challenge for the design of ICT, information and communication technology, for home care. 22. Because statistics show that over 80 million Americans have taken time off of their primary employment to care for a loved one. 23. Many countries have begun offering programs such as the Consumer-Directed Personal Assistant Program to allow family members to take care of their loved ones without giving up their entire income. Citation needed. With obesity in children rapidly becoming a major concern, health services often set up programs in schools aimed at educating children about nutritional eating habits, making physical education a requirement and teaching young adolescents to have a positive self-image. Citation needed. Ratings. Main article. Healthcare ratings. Healthcare ratings are ratings or evaluations of healthcare used to evaluate the process of care and healthcare structures and/or outcomes of healthcare services. This information is translated into report cards that are generated by quality organizations, nonprofit, consumer groups and media. This evaluation of quality is based on measures of health plan quality, hospital quality, of patient experience, physician quality, quality for other health professionals. Related sectors. Healthcare extends beyond the delivery of services to patients, encompassing many related sectors, and is set within a bigger picture of financing and governance structures. Health system. Main articles, health system and healthcare systems by country. A health system, also sometimes referred to as healthcare system or healthcare system, is the organization of people, institutions, and resources that deliver healthcare services to populations in need. Healthcare industry. See also, healthcare industry and health economics. The healthcare industry incorporates several sectors that are dedicated to providing healthcare services and products. As a basic framework for defining the sector, The United Nations International Standard Industrial Classification categorizes healthcare as generally consisting of hospital activities, medical and dental practice activities, and other human health activities. The last class involves activities of, or under the supervision of, nurses, midwives, physiotherapists, scientific or diagnostic laboratories, pathology clinics, residential health facilities, patient advocates, 24, or other allied health professions. In addition, according to industry and market classifications, such as the Global Industry Classification Standard and the Industry Classification Benchmark, healthcare includes many categories of medical equipment, instruments and services including biotechnology, diagnostic laboratories and substances, drug manufacturing and delivery. For example, pharmaceuticals and other medical devices are the leading high-technology exports of Europe and the United States. 26. The United States dominates the biopharmaceutical field, accounting for 3/4 of the world's biotechnology revenues. 27. Healthcare research. Main articles, medical research and nursing research. For a topical guide, see healthcare science. The quantity and quality of many healthcare interventions are improved through the results of science, such as advanced through the medical model of health which focuses on the eradication of illness through diagnosis and effective treatment. Many important advances have been made through health research, biomedical research and pharmaceutical research, which form the basis for evidence-based medicine and evidence-based practice in healthcare delivery. Healthcare research frequently engages directly with patients, and as such issues for whom to engage and how to engage with them become important to consider when seeking to actively include them in studies. While single best practice does not exist, the results of a systematic review on patient engagement suggest that research methods for patient selection need to account for both patient availability and willingness to engage. 28. Health services research can lead to greater efficiency and equitable delivery of healthcare interventions, as advanced through the social model of health and disability, which emphasizes the societal changes that can be made to make populations healthier. 29. Results from health services research often form the basis of evidence-based policy in healthcare systems. Health services research is also aided by initiatives in the field of artificial intelligence for the development of systems of health assessment that are clinically useful, timely, sensitive to change, culturally sensitive, low burden, low cost, built into standard procedures, and involve the patient. 30. Healthcare financing. See also, healthcare system, health policy, universal health care, health spending as % of gross domestic product, GDP, by country, and list of countries by total health expenditure per capita. Graphs are temporarily unavailable due to technical issues. See or edit source data. Total health spending as a fraction of GDP. 31. There are generally 5 primary methods of funding healthcare systems. Frowny face. 32. General taxation to the state, county or municipality. Social health insurance. Voluntary or private health insurance. Out-of-pocket payments. Donations to health charities. Life expectancy versus healthcare spending of rich OECD countries. U.S. average of $10,447 in 2018, 33. In most countries, there is a mix of all 5 models, but this varies across countries and over time within countries. Aside from financing mechanisms, an important question should always be how much to spend on health care. For the purposes of comparison, this is often expressed as the percentage of GDP spent on health care. In OECD countries, for every extra $1,000 spent on health care, life expectancy falls by 0.4 years. 34. A similar correlation is seen from the analysis carried out each year by Bloomberg. 35. Clearly, this kind of analysis is flawed in that life expectancy is only one measure of a health system's performance, but equally, the notion that more funding is better is not supported. In 2011, the healthcare industry consumed an average of 9.3% of the GDP, or $3,322 PPP adjusted, per capita across the 34 members of OECD countries. The US, 17.7%, or US dollars PPP 8,508, the Netherlands, 11.9%, 5,099, France, 11.6%, 4,118, Germany, 11.3%, 4,495, Canada, 11.2%, 5,669, and Switzerland, 11%, 5,634, were the top spenders. However, life expectancy in total population at birth was highest in Switzerland, 82.8 years, Japan and Italy, 82.7, Spain and Iceland, 82.4, France, 82.2, and Australia, 82.0, while OECD's average exceeds 80 years for the first time ever in 2011, 80.1 years, a gain of 10 years since 1970. The US, 78.7 years, ranges only on place 26 among the 34 OECD member countries, but has the highest costs by far. All OECD countries have achieved universal, or almost universal, health coverage, except the US and Mexico, 36, 37, see also international comparisons. In the United States, where around 18% of GDP is spent on health care, 35, the Commonwealth Fund analysis of spend and quality shows a clear correlation between worse quality and higher spending, 38. Expand the OECD charts below to see the breakdown. Government/compulsory, government spending and compulsory health insurance. Voluntary health insurance and private funds such as households' out-of-pocket payments, NGOs and private corporations. They are represented by columns starting at 0. They are not stacked. The two are combined to get the total. At the source you can run your cursor over the columns to get the year and the total for that country, 39. Click the Table tab at the source to get 3 lists, one after another, of amounts by country, total, government/compulsory, and voluntary. 39. Health spending by country. Percent of GDP, gross domestic product. For example, 11.2% for Canada in 2022. 16.6% for the United States in 2022. 39. Total healthcare cost per person. Public and private spending. US dollars PPP. For example, $6,319 for Canada in 2022. $12,555 for the US in 2022. 39. Administration and regulation. See also, health professional requisites. The management and administration of health care is vital to the delivery of healthcare services. In particular, the practice of health professionals and the operation of healthcare institutions is typically regulated by national or state/provincial authorities through appropriate regulatory bodies for purposes of quality assurance. 40. Most countries have credentialing staff in regulatory boards or health departments who document the certification or licensing of health workers and their work history. 41. Health information technology. Further information, health information technology, health information management, health informatics, e-health, and health technology. Health information technology, HIT, is the application of information processing involving both computer hardware and software that deals with the storage, retrieval, sharing, and use of healthcare information, data, and knowledge for communication and decision-making. 42. Health information technology components. Electronic health record, EHR. An EHR contains a patient's comprehensive medical history, and may include records from multiple providers. 43. Electronic medical record, EMR. An EMR contains the standard medical and clinical data gathered in one's provider's office. 43. Health Information Exchange, HIE. Health Information Exchange allows healthcare professionals and patients to appropriately access and securely share a patient's vital medical information electronically. 44. Medical Practice Management Software, MPM, is designed to streamline the day-to-day tasks of operating a medical facility. Also known as Practice Management Software or Practice Management System, PMS. Personal Health Record, PHR. A PHR is a patient's medical history that is maintained privately, for personal use. 45. Studies in 2022 focused on identifying how AI algorithms can bolster healthcare system preparedness for future pandemics, using real-time data from mobile devices and showcasing their effectiveness through predictive analysis and adaptive forecasting scenarios. 46. See also. Category: Healthcare by country. Global health. Health equity. Health policy. Healthcare system/health professionals. Tobacco control laws. Universal health care. Biomedical sciences are a set of sciences applying portions of natural science or formal science, or both, to develop knowledge, interventions, or technology that are of use in healthcare or public health. 1. Such disciplines as medical microbiology, clinical virology, clinical epidemiology, genetic epidemiology, and biomedical engineering are medical sciences. In explaining physiological mechanisms operating in pathological processes, however, pathophysiology can be regarded as basic science. Biomedical sciences, as defined by the UK Quality Assurance Agency for Higher Education benchmark statement in 2015, includes those science disciplines whose primary focus is the biology of human health and disease and ranges from the generic study of biomedical sciences and human biology to more specialized subject areas such as pharmacology, human physiology, and human nutrition. It is underpinned by relevant basic sciences including anatomy and physiology, cell biology, biochemistry, microbiology, genetics and molecular biology, pharmacology, immunology, mathematics and statistics, and bioinformatics, too. As such, the biomedical sciences have a much wider range of academic and research activities and economic significance than that defined by hospital laboratory sciences. Biomedical sciences are the major focus of bioscience research and funding in the 21st century, too. Roles within biomedical science. A subset of biomedical sciences is the science of clinical laboratory diagnosis. This is commonly referred to in the UK as biomedical science or healthcare science. 2. There are at least 45 different specialisms within healthcare science, which are traditionally grouped into three main divisions. Phase 3. Specialisms involving life sciences. Specialisms involving physiological science. Specialisms involving medical physics or bioengineering. Life sciences specialties. Molecular toxicology. Molecular pathology. Blood transfusion science. Cervical cytology. Clinical biochemistry. Clinical embryology. Clinical immunology. Clinical pharmacology and therapeutics. Electron microscopy. External quality assurance. Hematology. Hemostasis and thrombosis. Histocompatibility and immunogenetics. Histopathology and cytopathology. Molecular genetics and cytogenetics. Molecular biology and cell biology. Microbiology including mycology. Bacteriology. Tropical diseases. Phlebotomy. Tissue banking/transplant. Virology. Physiological science specialisms. Audiology and hearing therapy. Autonomic neurovascular function. Cardiac physiology. Clinical perfusion. Critical care science. Gastrointestinal physiology. Neurophysiology. Ophthalmic and vision science. Respiratory and sleep physiology. Urology. Vascular science. Pharmacology and toxicology. Physics and bioengineering specialisms. Biomechanical engineering. Biomedical engineering. Clinical engineering. Clinical measurement. Diagnostic radiology. Equipment management. Maxillofacial prosthetics. Medical electronics. Medical engineering design. Medical illustration and clinical photography. Non-ionizing radiation. Nuclear medicine. Radiopharmacy. Radiation protection and monitoring. Radiotherapy physics. Rehabilitation engineering. Renal technology and science. Ultrasound. Biomedical science in the United Kingdom. The healthcare science workforce is an important part of the UK's National Health Service. While people working in healthcare science are only 5% of the staff of the NHS, 80% of all diagnoses can be attributed to their work. 4. The volume of specialist healthcare science work is a significant part of the work of the NHS. Every year, NHS healthcare scientists carry out phase citation needed, nearly 1 billion pathology laboratory tests, more than 12 million physiological tests, support for 1.5 million fractions of radiotherapy. The four governments of the UK have recognised the importance of healthcare science to the NHS, introducing the Modernising Scientific Careers initiative to make certain that the education and training for healthcare scientists ensures there is the flexibility to meet patient needs while keeping up to date with scientific developments. 5. Graduates of an accredited biomedical science degree program can also apply for the NHS Scientist Training Program, which gives successful applicants an opportunity to work in a clinical setting whilst also studying towards an MSc or doctoral qualification. Citation needed. Biomedical science in the 20th century. At this point in history, the field of medicine was the most prevalent subfield of biomedical science, as several breakthroughs on how to treat diseases and help the immune system were made, as well as the birth of body augmentations. Citation needed. 1910s. In 1912, the Institute of Biomedical Science was founded in the United Kingdom. The institute is still standing today and still regularly publishes works in the major breakthroughs in disease treatments and other breakthroughs in the field 117 years later. The IBMS today represents approximately 20,000 members employed mainly in National Health Service and private laboratories. Citation needed. 1920s. In 1928, British scientist Alexander Fleming discovered the first antibiotic penicillin. This was a huge breakthrough in biomedical science because it allowed for the treatment of bacterial infections. Citation needed. In 1926, the first artificial pacemaker was made by Australian physician Dr. Mark C. Lidwell. This portable machine was plugged into a lighting point. One pole was applied to a skin pad soaked with strong salt solution, while the other consisted of a needle insulated up to the point and was plunged into the appropriate cardiac chamber, and the machine started. A switch was incorporated to change the polarity. The pacemaker rate ranged from about 80 to 120 pulses per minute, and the voltage also variable from 1.5 to 120 volts. 6. 1930s. The 1930s was a huge era for biomedical research, as this was the era where antibiotics became more widespread and vaccines started to be developed. In 1935, the idea of a polio vaccine was introduced by Dr. Maurice Brodie. Brodie prepared a dyed poliomyelitis vaccine, which he then tested on chimpanzees, himself, and several children. Brodie's vaccine trials went poorly since the polio virus became active in many of the human test subjects. Many subjects had fatal side effects, paralyzing, and causing death. 7. 1940s. During and after World War II, the field of biomedical science saw a new age of technology and treatment methods. For instance, in 1941 the first hormonal treatment for prostate cancer was implemented by urologist and cancer researcher Charles B. Huggins. Huggins discovered that if you remove the testicles from a man with prostate cancer, the cancer had nowhere to spread, and nothing to feed on, thus putting the subject into remission. 8. This advancement led to the development of hormonal blocking drugs, which is less invasive and still used today. At the tail end of this decade, the first bone marrow transplant was done on a mouse in 1949. The surgery was conducted by Dr. Leon O. Jacobson. He discovered that he could transplant bone marrow and spleen tissues in a mouse that had both no bone marrow and a destroyed spleen. 9. The procedure is still used in modern medicine today and is responsible for saving countless lives. Citation needed. 1950s. In the 1950s, we saw innovation in technology across all fields, but most importantly there were many breakthroughs which led to modern medicine. On March 6, 1953, Dr. Jonas Salk announced the completion of the first successful killed virus polio vaccine. The vaccine was tested on about 1.6 million Canadian, American, and Finnish children in 1954. The vaccine was announced as safe on 12 April 1955. 10. See also: Academic Health Science Center, Biomedical Research, Biomedical Technology, Health Sciences Descriptors, Healthcare Science, Medical Diagnosis, Medical Laboratory, Medical Scientist, Public Health, Publicly Funded Healthcare, Biomedical Research Institution, Austral University Hospital. For the biomedical research journals, see Biomedical Research. Biomedical Research Reader Rex here. Not to be confused with biomedical science. Cell culture vials. The University of Florida Cancer and Genetics Research Complex is an integrated medical research facility. Medical research, or biomedical research, also known as experimental medicine, encompasses a wide array of research, extending from basic research, also called bench science or bench research, 1. Involving fundamental scientific principles that may apply to a preclinical understanding, to clinical research, which involves studies of people who may be subjects in clinical trials. Within this spectrum is applied research, or translational research, conducted to expand knowledge in the field of medicine. Both clinical and preclinical research phases exist in the pharmaceutical industry's drug development pipelines, where the clinical phase is denoted by the term clinical trial. However, only part of the clinical or preclinical research is oriented towards a specific pharmaceutical purpose. The need for fundamental and mechanism-based understanding, diagnostics, medical devices, and non-pharmaceutical therapies means that pharmaceutical research is only a small part of medical research. The increased longevity of humans over the past century can be significantly attributed to advances resulting from medical research. Among the major benefits of medical research have been vaccines for measles and polio, insulin treatment for diabetes, classes of antibiotics for treating a host of maladies, medication for high blood pressure, improved treatments for AIDS, statins and other treatments for atherosclerosis, new surgical techniques such as microsurgery, and increasingly successful treatments for cancer. New, beneficial tests and treatments are expected as a result of the Human Genome Project. Many challenges remain, however, including the appearance of antibiotic resistance and the obesity epidemic. Most of the research in the field is pursued by biomedical scientists, but significant contributions are made by other type of biologists. Medical research on humans has to strictly follow the medical ethics sanctioned in the Declaration of Helsinki and Hospital Review Board where the research is conducted. In all cases, research ethics are expected. Phases of medical research. Basic medical research. Cold Spring Harbor Laboratory on Long Island, home to 8 scientists awarded the Nobel Prize in Physiology or Medicine, is an internationally renowned basic medical research institution. Example areas in basic medical research include cellular and molecular biology, medical genetics, immunology, neuroscience, and psychology. Researchers, mainly in universities or government-funded research institutes, aim to establish an understanding of the cellular, molecular and physiological mechanisms of human health and disease. Citation needed. Preclinical research. Preclinical research covers understanding of mechanisms that may lead to clinical research with people. Typically, the work requires no ethical approval, is supervised by scientists rather than physicians, and is carried out in a university or company, rather than a hospital. Citation needed. Clinical research. Clinical research is carried out with people as the experimental subjects. It is generally supervised by physicians and conducted by nurses in a medical setting, such as a hospital or research clinic, and requires ethical approval. Funding. Further information, research funding. The headquarters of the Wellcome Trust in London, United Kingdom. Biomedical research and development expenditures classified by region in 2012 in billions of US dollars. Frowny face 2. Region total public industry. United States 119.348.970.4. Canada 5.3 Europe 81.828.153.6. Asia Oceania 62.019.342.7. Total 268.4. This article needs to be updated. Please help update this article to reflect recent events or newly available information. August 2017. Research funding in many countries derives from research bodies and private organizations which distribute money for equipment, salaries, and research expenses. United States, Europe, Asia, Canada, and Australia combined spent $265.0 billion in 2011, which reflected growth of 3.5% annually from $208.8 billion in 2004-3. The United States contributed 49% of governmental funding from these regions in 2011 compared to 57% in 2004-3. In the United Kingdom, funding bodies such as the National Institute for Health and Care Research, NIHR, and the Medical Research Council derive their assets from UK taxpayers and distribute revenues to institutions by competitive research grants. The Wellcome Trust is the UK's largest non-governmental source of funds for biomedical research and provides over £600 million per year in grants to scientists and funds for research centres. 4. In the United States, data from ongoing surveys by the National Science Foundation, NSF, show th. government-funded biomedical research. Since the establishment of the National Institutes of Health, NIH, in the mid-1940s, the main source of U.S. federal support of biomedical research, investment priorities and levels of funding have fluctuated. From 1995 to 2010, NIH support of biomedical research increased from $11 billion to $27 billion. 8. Despite the jump in federal spending, advancements measured by citations to publications and the number of drugs passed by the FDA remained stagnant over the same time span. 9. Financial projections indicate federal spending will remain constant in the near future. 9. U.S. federal funding trends. The National Institutes of Health, NIH, is the agency that is responsible for management of the lion's share of federal funding of biomedical research. 8. It funds over 280 areas directly related to health. 10. Over the past century, there were 2 notable periods of NIH support. From 1995 to 1996 funding increased from $8.877 billion to $9.366 billion, 11 years, which represented the start of what is considered the doubling period of rapid NIH support. 8. The second notable period started in 1997 and ended in 2010, a period where the NIH moved to organize research spending for engagement with the scientific community. 11. Privately, industry-funded biomedical research. Further information, industry-funded research. Since 1980, the share of biomedical research funding from industry sources has grown from 32% to 62%, 12, which has resulted in the development of numerous life-saving medical advances. The relationship between industry and government-funded research in the U.S. has seen great movement over the years. The 1980 Bayh-Dole Act was passed by Congress to foster a more constructive relationship between the collaboration of government and industry-funded biomedical research. The Bayh-Dole Act gave private corporations the option of applying for government-funded grants for biomedical research, which in turn allowed the private corporations to license the technology. 13. Both government and industry research funding increased rapidly from between the years of 1994 to 2003. Industry saw a compound average annual growth rate of 8.1% a year and slowed only slightly to a compound average annual growth rate of 5.8% from 2003 to 2008. 14. Conflicts of interests. Conflict of interest in the field of medical research has been defined as a set of conditions in which professional judgment concerning a primary interest, such as a person's welfare or the validity of research, tends to be unduly influenced by a secondary interest, such as financial gain. 15. Regulation on industry-funded biomedical research has seen great changes since Samuel Hopkins Adams' Declaration. In 1906, Congress passed the Pure Food and Drugs Act of 1906. 16. In 1912, Congress passed the Shirley Amendment to prohibit the wide dissemination of false information on pharmaceuticals. 16. The Food and Drug Administration was formally created in 1930 under the McNary-Mapes Amendment to oversee the regulation of food and drugs in the United States. 16. In 1962, the Kefauver-Harris Amendments to the Food, Drug and Cosmetics Act made it so that before a drug was marketed in the United States, the FDA must first approve that the drug was safe. 16. The Kefauver-Harris Amendments also mandated that more stringent clinical trials must be performed before a drug is brought to the market. 17. The Kefauver-Harris Amendments were met with opposition from industry due to the requirement of lengthier clinical trial periods that would lessen the period of time in which the investor is able to see return on their money. In the pharmaceutical industry, patents are typically granted for a 20-year period of time, and most patent applications are submitted during the early stages of the product development. 17. According to Ariel Katz, on average, after a patent application is submitted, it takes an additional 8 years before the FDA approves a drug for marketing. 17. As such, this would leave a company with only 12 years to market the drug to see a return on their investments. After a sharp decline of new drugs entering the U.S. market following the 1962 Kefauver-Harris Amendments, economist Sam Pedelsman concluded that cost of loss of innovation was greater than the savings recognized by consumers no longer purchasing ineffective drugs. 17. In 1984, the Hatch-Waxman Act, or the Drug Price Competition and Patent Term Restoration Act of 1984, was passed by Congress. 16. The Hatch-Waxman Act was passed with the idea that giving brand manufacturers the ability to extend their patent by an additional 5 years would create greater incentives for innovation and private sector funding for investment. 18. The relationship that exists with industry-funded biomedical research is that of which industry is the financier for academic institutions, which in turn employ scientific investigators to conduct research. A fear that exists wherein a project is funded by industry is that firms might negate informing the public of negative effects to better promote their product. 17. A list of studies shows that public fear of the conflicts of interest that exist when biomedical research is funded by industry can be considered valid after a 2003 publication of Scope and Impact of Financial Conflicts of Interest in Biomedical Research in the Journal of American Association of Medicine. This publication included 37 different studies that met specific criteria to determine whether or not an academic institution or scientific investigator funded by industry had engaged in behavior that could be deduced to be a conflict of interest in the field of biomedical research. Survey results from one study concluded that 43% of scientific investigators employed by a participating academic institution had received research-related gifts and discretionary funds from industry sponsors. 12. Another participating institution surveyed showed that 7.6% of investigators were financially tied to research sponsors, including paid speaking engagements, 34%, consulting arrangements, 33%, advisory board positions, 32%, and equity, 14%. 12. A 1994 study concluded that 58% out of 210 life science companies indicated that investigators were required to withhold information pertaining to their research as to extend the life of the interested company's patents. 12. Rules and regulations regarding conflict of interest disclosures are being studied by experts in the biomedical research field to eliminate conflicts of interest that could possibly affect the outcomes of biomedical research. Transparency laws. Two laws which are both still in effect, one passed in 2006 and the other in 2010, were instrumental in defining funding reporting standards for biomedical research, and defining for the first time reporting regulations that were previously not required. The 2006 Federal Funding Accountability and Transparency Act mandates that all entities receiving over $25,000 in federal funds must report annual spending reports, including disclosure of executive salaries. 19. The 2010 amendment to the Act mandates that progress reports be submitted along with financial reporting. 19. Data from the federal mandate is managed and made publicly available on usaspending.gov. 19. Aside from the main source, usaspending.gov, other reporting mechanisms exist. Data specifically on biomedical research funding from federal sources is made publicly available by the National Health Expenditure Accounts, NHEA. Data on health services research, approximately 0.1% of federal funding on biomedical research, is available through the Coalition of Health Services Research, the Agency for Healthcare Research and Quality, the Centers for Disease Control and Prevention, the Centers for Medicare and Medicaid Services, and the Veterans Health Administration. 20. Currently, there are not any funding reporting requirements for industry-sponsored research, but there has been voluntary movement toward this goal. 21. In 2014, major pharmaceutical stakeholders such as Roche and Johnson & Johnson have made financial information publicly available, and Pharmaceutical Research and Manufacturers of America, PHRMA, the most prominent professional association for biomedical research companies, has recently begun to provide limited public funding reports. 21. History. Ancient to 20th century in other regions. Further information, History of Medicine and History of Pharmacy. The earliest narrative describing a medical trial is found in the Book of Daniel, which says that Babylonian King Nebuchadnezzar ordered youths of royal blood to eat only red meat and wine for 3 years, while another group of youths ate only beans and water. 22. The experiment was intended to determine if a diet of vegetables and water was healthier than a diet of wine and red meat. At the experiment endpoint, the trial accomplished its prerogative. The youths who ate only beans and water were noticeably healthier. 22. Scientific curiosity to understand health outcomes from varying treatments has been present for centuries, but it was not until the mid-19th century when an organizational platform was created to support and regulate this curiosity. In 1945, Vannevar Bush said that biomedical scientific research was the pacemaker of technological progress, an idea which contributed to the initiative to found the National Institutes of Health, NIH, in 1948, a historical benchmark that marked the beginning of a near-century substantial investment in biomedical research. 23. 20th and 21st century in the United States. The NIH provides more financial support for medical research than any other agency in the world to date and claims responsibility for numerous innovations that have improved global health. 23. The historical funding of biomedical research has undergone many changes over the past century. Innovations such as the polio vaccine, antibiotics, and antipsychotic agents, developed in the early years of the NIH, lead to social and political support of the agency. Political initiatives in the early 1990s lead to a doubling of NIH funding, spurring an era of great scientific progress. 24. There have been dramatic changes in the era since the turn of the 21st century to date. Roughly around the start of the century, the cost of trials dramatically increased while the rate of scientific discoveries did not keep pace. 24. Biomedical research spending increased substantially faster than GDP growth over the past decade in the U.S., between the years of 2003 and 2007 spending increased 14% per year, while GDP growth increased 1% over the same period, both measures adjusted for inflation. 20. Industry, not-for-profit entities. State and federal funding spending combined accounted for an increase in funding from $75.5 billion in 2003 to $101.1 billion in 2007. 20. Due to the immediacy of federal financing priorities and stagnant corporate spending during the recession, biomedical research spending decreased 2% in real terms in 2008. 20. Despite an overall increase of investment in biomedical research, there has been stagnation, and in some areas a marked decline in the number of drug and device approvals over the same time period. 20. As of 2010, industry-sponsored research accounts for 58% of expenditures, NIH for 27% of expenditures, state governments for 5% of expenditures, non-NIH federal sources for 5% of expenditures, and not-for-profit entities accounted for 4% of support. 20. Federally funded biomedical research expenditures increased nominally, 0.7%, adjusted for inflation, from 2003 to 2007. 20. Previous reports showed a stark contrast in federal investment. From 1994 to 2003, federal funding increased 100%. Adjusted for inflation. 20. The NIH manages the majority, over 85%, of federal biomedical research expenditures. 20. NIH support for biomedical research decreased from $31.8 billion in 2003 to $29.0 billion in 2007, a 25% decline, in real terms adjusted for inflation, while non-NIH federal funding allowed for the maintenance of government financial support levels through the era, the 0.7% four-year increase. Spending from industry-initiated research increased 25%, adjusted for inflation, over the same time period of time, from 2003 to 2007, an increase from $40 billion in 2003 to $58.6 billion in 2007. 20. Industry-sourced expenditures from 1994 to 2003 showed industry-sponsored research funding increased 8.1%, a stark contrast to 25% increase in recent years. 20. Of industry-sponsored research, pharmaceutical firm spending was the greatest contributor from all industry-sponsored biomedical research spending, but only increased 15%, adjusted for inflation, from 2003 to 2007, while device and biotechnology firms accounted for the majority of the spending. 20. The stock performance, a measure that can be an indication of future firm growth or technological direction, has substantially increased for both predominantly medical device and biotechnology. Producers. 20. Contributing factors to this growth are thought to be less rigorous FDA approval requirements for devices as opposed to drugs, lower cost of trials, lower pricing and profitability of products, and predictable influence of new technology due to a limited number of competitors. 20. Another visible shift during the era was a regulations and guidelines. Medical research is highly regulated. National regulatory authorities are appointed in most countries to oversee and monitor medical research, such as for the development and distribution of new drugs. In the United States, the Food and Drug Administration oversees new drug development. In Europe, the European Medicines Agency, see also EUDRALEX, and in Japan, the Ministry of Health, Labor and Welfare. The World Medical Association develops the ethical standards for medical professionals involved in medical research. The most fundamental of them is the Declaration of Helsinki. The International Conference on Harmonization of Technical Requirements for Registration of Pharmaceuticals for Human Use, ICH, works on the creation of rules and guidelines for the development of new medication, such as the Guidelines for Good Clinical Practice, GCP. All ideas of regulation are based on a country's ethical standards code. This is why treatment of a particular disease in one country may not be allowed, but is in another. Flaws and vulnerabilities. A major flaw and vulnerability in biomedical research appears to be the hyper-competition for the resources and positions that are required to conduct science. The competition seems to suppress the creativity, cooperation, risk-taking, and original thinking required to make fundamental discoveries. Other consequences of today's highly pressured environment for research appear to be a substantial number of research publications whose results cannot be replicated, and perverse incentives in research funding that encourage grantee institutions to grow without making sufficient investments in their own faculty and facilities. 26, 27, 28. 29, 30. Other risky trends include a decline in the share of key research grants going to younger scientists, as well as a steady rise in the age at which investigators receive their first funding. 31. Commercialization. After clinical research, medical therapies are typically commercialized by private companies such as pharmaceutical companies or medical device company. In the United States, one estimate found that in 2011, one-third of Medicare physician and outpatient hospital spending was on new technologies unavailable in the prior decade. 32. Medical therapies are constantly being researched, so the difference between a therapy which is investigational versus standard of care is not always clear, particularly given cost-effectiveness considerations. 33. Payers have utilization management clinical guidelines which do not pay for experimental or investigational therapies, or may require that the therapy is medically necessary or superior to cheaper treatments. For example, proton therapy was approved by the FDA, but private health insurers in the United States considered it unproven or unnecessary given its high cost, although it was ultimately covered for certain cancers. 34. Fields of research. Fields of biomedical research include aging, anatomy, behavioral health, biochemistry, biomaterials, biology, cellular biology, molecular biology, cardiovascular, biostatistics, cancer, chemistry, diabetes, endocrinology, epigenetics, epidemiology, genetics, immunology, microbiology, nanomaterials, neuroendocrinology, neuroscience, ophthalmology, pharmacology, physiology, preventive medicine, psychopharmacology, public health, tissue engineering, virology, otolaryngology, toxicology, angiology, palliative medicine. See also animal testing, biomedical informatics, biomedical research in the United States, biomedical technology, biomedicine, cancer research, gain-of-function research, medical research scientist, medical scientist training program, pharmaceutical company, preclinical imaging. Title 21 of the Code of Federal Regulations, U.S. Clinical Genetics redirects here. For the journal, see Clinical Genetics, Journal. For a non-technical introduction to the topic, see Introduction to Genetics. Part of a series on genetics, key components, history and topics, research, personalized medicine. Category: VET. Medical genetics is the branch of medicine that involves the diagnosis and management of hereditary disorders. Medical genetics differs from human genetics in that human genetics is a field of scientific research that may or may not apply to medicine, while medical genetics refers to the application of genetics to medical care. For example, research on the causes and inheritance of genetic disorders would be considered within both human genetics and medical genetics, while the diagnosis, management, and counseling people with genetic disorders would be considered part of medical genetics. In contrast, the study of typically non-medical phenotypes such as the genetics of eye color would be considered part of human genetics, but not necessarily relevant to medical genetics, except in situations such as albinism. Genetic medicine is a newer term for medical genetics and incorporates areas such as gene therapy, personalized medicine, and the rapidly emerging new medical specialty, predictive medicine. Autosomal dominant and autosomal recessive inheritance, the two most common Mendelian inheritance patterns. An autosome is any chromosome other than a sex chromosome. Scope. Medical genetics encompasses many different areas, including clinical practice of physicians, genetic counselors, and nutritionists, clinical diagnostic laboratory activities, and research into the causes and inheritance of genetic disorders. Examples of conditions that fall within the scope of medical genetics include birth defects and dysmorphology, intellectual disabilities, autism, mitochondrial disorders, skeletal dysplasia, connective tissue disorders, cancer genetics, and prenatal diagnosis. Medical genetics is increasingly becoming relevant to many common diseases. Overlaps with other medical specialties are beginning to emerge as recent advances in genetics are revealing etiologies for morphologic, endocrine, cardiovascular, pulmonary, ophthalmologist, renal, psychiatric, and dermatologic conditions. The medical genetics community is increasingly involved with individuals who have undertaken elective genetic and genomic testing. Subspecialties. In some ways, many of the individual fields within medical genetics are hybrids between clinical care and research. This is due in part to recent advances in science and technology, for example, see the Human Genome Project, that have enabled an unprecedented understanding of genetic disorders. Clinical genetics. Clinical genetics, a medical specialty with particular attention to hereditary disorders. Branches of clinical genetics include 1. Prenatal genetics. Couples at risk of having a child with a genetic disorder preconception or while pregnant. High-risk prenatal screening results. Abnormal fetal ultrasound. 2. Pediatric genetics. Birth defects. Developmental disability, autism, epilepsy. Short stature and skeletal dysplasia. 3. Adult genetics. Cardiomyopathy and cardiac dysrhythmias. Inherited kidney disease. Dementia and neurodegeneration. Connective tissue disease. 4. Cancer genetics. Breast/ovarian cancer. Bowel cancer. Endocrine tumors. Examples of genetic syndromes that are commonly seen in the genetics clinic include chromosomal rearrangements, e.g. Down syndrome, 22q11.2 deletion syndrome, Turner syndrome, Williams syndrome, Fragile X syndrome, Marfan syndrome, neurofibromatosis, Huntington disease, familial adenomatous polyposis, and many more. Training and qualification. In the United States, physicians who practice clinical genetics are accredited by the American Board of Medical Genetics and Genomics, ABMGG. 1. In order to become a board-certified practitioner of clinical genetics, a physician must complete a minimum of 24 months of training in a program accredited by the ABMGG. Individuals seeking acceptance into clinical genetics training programs must hold an MD or DO degree, or their equivalent, and have completed a minimum of 12 months of training in an ACGME-accredited residency program in internal medicine, pediatrics, obstetrics and gynecology, or other medical specialty. 2. In Australia and New Zealand, clinical genetics is a 3-year advanced training program for those who already have their primary medical qualification, MBBS or MD, and have successfully completed basic training in either pediatric medicine or adult medicine. Training is overseen by the Royal Australasian College of Physicians, with the Australasian Association of Clinical Geneticists contributing to authorship of the curriculum via their parent organisation, the Human Genetics Society of Australasia. 3. Metabolic/biochemical genetics. Metabolic, or biochemical, genetics involves the diagnosis and management of inborn errors of metabolism in which patients have enzymatic deficiencies that perturb biochemical pathways involved in metabolism of carbohydrates, amino acids, and lipids. Examples of metabolic disorders include galactosemia, glycogen storage disease, lysosomal storage disorders, metabolic acidosis, peroxisomal disorders, phenylketonuria, and urea cycle disorders. Cytogenetics. Cytogenetics is the study of chromosomes and chromosome abnormalities. While cytogenetics historically relied on microscopy to analyze chromosomes, new molecular technologies such as array comparative genomic hybridization are now becoming widely used. Examples of chromosome abnormalities include aneuploidy, chromosomal rearrangements, and genomic deletion/duplication disorders. Molecular genetics. Molecular genetics involves the discovery of and laboratory testing for DNA mutations that underlie many single-gene disorders. Examples of single-gene disorders include achondroplasia, cystic fibrosis, Duchenne muscular dystrophy, hereditary breast cancer, BRCA1/2, Huntington disease, Marfan syndrome, Noonan syndrome, and Rett syndrome. Molecular tests are also used in the diagnosis of syndromes involving epigenetic abnormalities, such as Angelman syndrome, Beckwith-Wiedemann syndrome, Prader-Willi syndrome, and uniparental disomy. Mitochondrial genetics. Mitochondrial genetics concerns the diagnosis and management of mitochondrial disorders, which have a molecular basis but often result in biochemical abnormalities due to deficient energy production. There exists some overlap between medical genetic diagnostic laboratories and molecular pathology. Genetic counseling. Genetic counseling is the process of providing information about genetic conditions, diagnostic testing, and risks in other family members, within the framework of non-directive counseling. Genetic counselors are non-physician members of the medical genetics team who specialize in family risk assessment and counseling of patients regarding genetic disorders. The precise role of the genetic counselor varies somewhat depending on the disorder. When working alongside geneticists, genetic counselors normally specialize in pediatric genetics, which focuses on developmental abnormalities present in newborns, infants, or children. The major goal of pediatric counseling is attempting to explain the genetic basis behind the child's developmental concerns in a compassionate and articulated manner that allows the potentially distressed or frustrated parents to easily understand the information. As well, genetic counselors normally take a family pedigree, which summarizes the medical history of the patient's family. This then aids the clinical geneticist in the differential diagnosis process and help determine which further steps should be taken to help the patient. 4. History. Although genetics has its roots back in the 19th century with the work of the Bohemian monk Gregor Mendel and other pioneering scientists, human genetics emerged later. It started to develop, albeit slowly, during the first half of the 20th century. Mendelian, single-gene, inheritance was studied in a number of important disorders such as albinism, brachydactyly, short fingers and toes, and hemophilia. Mathematical approaches were also devised and applied to human genetics. Population genetics was created. Medical genetics was a late developer, emerging largely after the close of World War II, 1945, when the eugenics movement had fallen into disrepute. 5. The Nazi misuse of eugenics sounded its death knell. 6. Shorn of eugenics, a scientific approach, could be used and was applied to human and medical genetics. Medical genetics saw an increasingly rapid rise in the second half of the 20th century and continues in the 21st century. Current practice. The clinical setting in which patients are evaluated determines the scope of practice, diagnostic, and therapeutic interventions. For the purposes of general discussion, the typical encounters between patients and genetic practitioners may involve referral to an outpatient genetics clinic, pediatric, adult, or combined, or an in-hospital consultation, most often for diagnostic evaluation. Specialty genetics clinics focusing on management of inborn errors of metabolism, skeletal dysplasia, or lysosomal storage diseases. Referral for counseling in a prenatal genetics clinic to discuss risks to the pregnancy, advanced maternal age, teratogen exposure, family history of a genetic disease, test results, abnormal maternal serum screen, abnormal ultrasound, and/or options for prenatal diagnosis, typically non-invasive prenatal screening, diagnostic amniocentesis or chorionic villus sampling. Multidisciplinary specialty clinics that include a clinical geneticist or genetic counselor, cancer genetics, cardiovascular genetics, craniofacial or cleft lip/palate, hearing loss clinics, muscular dystrophy/neurodegenerative disorder clinics. Diagnostic evaluation. Each patient will undergo a diagnostic evaluation tailored to their own particular presenting signs and symptoms. The geneticist will establish a differential diagnosis and recommend appropriate testing. These tests might evaluate for chromosomal disorders, inborn errors of metabolism, or single-gene disorders. Chromosome studies. Schematic karyogram of a human, with annotated bands and subbands as used in the International System for Human Cytogenomic Nomenclature for chromosomal abnormalities. It shows dark and white regions on G banding. It shows 22 homologous chromosomes, both the male, XY, and female, XX, versions of the sex chromosome, bottom right, as well as the mitochondrial genome, at bottom left. Further information, karyotype. Chromosome studies are used in the general genetics clinic to determine a cause for developmental delay or intellectual disability, birth defects, dysmorphic features, or autism. Citation needed. Chromosome analysis is also performed in the prenatal setting to determine whether a fetus is affected with aneuploidy or other chromosome rearrangements. Finally, chromosome abnormalities are often detected in cancer samples. A large number of different methods have been developed for chromosome analysis. Chromosome analysis using a karyotype involves special stains that generate light and dark bands, allowing identification of each chromosome under a microscope. Fluorescence in situ hybridization, FISH, involves fluorescent labeling of probes that bind to specific DNA sequences, used for identifying aneuploidy, genomic deletions or duplications, characterizing chromosomal translocations and determining the origin of ring chromosomes. Chromosome painting is a technique that uses fluorescent probes specific for each chromosome to differentially label each chromosome. This technique is more often used in cancer cytogenetics, where complex chromosome rearrangements can occur. Array comparative genomic hybridization is a newer molecular technique that involves hybridization of an individual DNA sample to a glass slide or microarray chip containing molecular probes, ranging from large 200 kb bacterial artificial chromosomes to small oligonucleotides that represent unique regions of the genome. This method is particularly sensitive for detection of genomic gains or losses across the genome but does not detect balanced translocations or distinguish the location of duplicated genetic material, for example, a tandem duplication versus an insertional duplication. Basic metabolic studies. Biochemical studies are performed to screen for imbalances of metabolites in the bodily fluid, usually the blood, plasma/serum, or urine, but also in cerebrospinal fluid, CSF. Specific tests of enzyme function, either in leukocytes, skin fibroblasts, liver, or muscle, are also employed under certain circumstances. In the U.S., the newborn screen incorporates biochemical tests to screen for treatable conditions such as galactosemia and phenylketonuria, PKU. Patients suspected to have a metabolic condition might undergo the following tests. Quantitative amino acid analysis is typically performed using the ninhydrin reaction, followed by liquid chromatography to measure the amount of amino acid in the sample, either urine, plasma/serum, or CSF. Measurement of amino acids in plasma or serum is used in the evaluation of disorders of amino acid metabolism such as urea cycle disorders, maple syrup urine disease, and PKU. Measurement of amino acids in urine can be useful in the diagnosis of cystinuria or renal Fanconi syndrome, as can be seen in cystinosis. Urine organic acid analysis can be either performed using quantitative or qualitative methods, but in either case the test is used to detect the excretion of abnormal organic acids. These compounds are normally produced during bodily metabolism of amino acids and odd-chain fatty acids, but accumulate in patients with certain metabolic conditions. The acyl-carnitine combination profile detects compounds such as organic acids and fatty acids conjugated to carnitine. The test is used for detection of disorders involving fatty acid metabolism, including CAD. Pyruvate and lactate are byproducts of normal metabolism, particularly during anaerobic metabolism. These compounds normally accumulate during exercise or ischemia, but are also elevated in patients with disorders of pyruvate metabolism or mitochondrial disorders. Ammonia is an end product of amino acid metabolism and is converted in the liver to urea through a series of enzymatic reactions termed the urea cycle. Elevated ammonia can therefore be detected in patients with urea cycle disorders, as well as other conditions involving liver failure. Enzyme testing is performed for a wide range of metabolic disorders to confirm a diagnosis suspected based on screening tests. Molecular studies. DNA sequencing is used to directly analyze the genomic DNA sequence of a particular gene. In general, only the parts of the gene that code for the expressed protein, exons, and small amounts of the flanking untranslated regions and introns are analyzed. Therefore, although these tests are highly specific and sensitive, they do not routinely identify all of the mutations that could cause disease. DNA methylation analysis is used to diagnose certain genetic disorders that are caused by disruptions of epigenetic mechanisms such as genomic imprinting and uniparental disomy. Southern blotting is an early technique basic on detection of fragments of DNA separated by size through gel electrophoresis and detected using radiolabeled probes. This test was routinely used to detect deletions or duplications in conditions such as Duchenne muscular dystrophy, but is being replaced by high-resolution array comparative genomic hybridization techniques. Southern blotting is still useful in the diagnosis of disorders caused by trinucleotide repeats. Treatments. Each cell of the body contains the hereditary information, DNA, wrapped up in structures called chromosomes. Since genetic syndromes are typically the result of alterations of the chromosomes or genes, there is no treatment currently available that can correct the genetic alterations in every cell of the body. Therefore, there is currently no cure for genetic disorders. However, for many genetic syndromes there is treatment available to manage the symptoms. In some cases, particularly in born errors of metabolism, the mechanism of disease is well understood and offers the potential for dietary and medical management to prevent or reduce the long-term complications. In other cases, infusion therapy is used to replace the missing enzyme. Current research is actively seeking to use gene therapy or other new medications to treat specific genetic disorders. Management of metabolic disorders. In general, metabolic disorders arise from enzyme deficiencies that disrupt normal metabolic pathways. For instance, in the hypothetical example, compound A is metabolized to B by enzyme X, compound B is metabolized to C by enzyme Y, and compound C is metabolized to D by enzyme Z. If enzyme Z is missing, compound D will be missing, while compounds A, B, and C will build up. The pathogenesis of this particular condition could result from lack of compound D, if it is critical for some cellular function, or from toxicity due to excess A, B, and/or C, or from toxicity due to the excess of E, which is normally only present in small amounts and only accumulates when C is in excess. Treatment of the metabolic disorder could be achieved through dietary supplementation of compound D and dietary restriction of compounds A, B, and/or C, or by treatment with a medication that promoted disposal of excess A, B, C, or E. Another approach that can be taken is enzyme replacement therapy, in which a patient is given an infusion of the missing enzyme Z or cofactor therapy to increase the efficacy of any residual Z activity. Diet. Dietary restriction and supplementation are key measures taken in several well-known metabolic disorders, including galactosemia, phenylketonuria, PKU, maple syrup urine disease, organic acidurias, and urea cycle disorders. Such restrictive diets can be difficult for the patient and family to maintain, and require close consultation with a nutritionist who has special experience in metabolic disorders. The composition of the diet will change depending on the caloric needs of the growing child, and special attention is needed during a pregnancy if a woman is affected with one of these disorders. Medication. Medical approaches include enhancement of residual enzyme activity, in cases where the enzyme is made but is not functioning properly, inhibition of other enzymes in the biochemical pathway to prevent buildup of a toxic compound, or diversion of a toxic compound to another form that can be excreted. Examples include the use of high doses of pyridoxine, vitamin B6, in some patients with homocystinuria to boost the activity of the residual cystathione synthase enzyme, administration of biotin to restore activity of several enzymes affected by deficiency of biotinidase, treatment with NTBC in tyrosinemia to inhibit the production of succinylacetone which causes liver toxicity, and the use of sodium benzoate to decrease ammonia buildup in urea cycle disorders. Enzyme replacement therapy. Certain lysosomal storage diseases are treated with infusions of a recombinant enzyme, produced in a laboratory, which can reduce the accumulation of the compounds in various tissues. Examples include Gaucher disease, Fabry disease, mucopolysaccharidosis, and glycogen storage disease type 2. Such treatments are limited by the ability of the enzyme to reach the affected areas. The blood-brain barrier prevents enzyme from reaching the brain, for example, and can sometimes be associated with allergic reactions. The long-term clinical effectiveness of enzyme replacement therapies vary widely among different disorders. Other examples: angiotensin receptor blockers in Marfan syndrome and Loeys-Dietz, bone marrow transplantation, gene therapy, career paths and training, Globicon. The examples and perspective in this article deal primarily with the United States and do not represent a worldwide view of the subject. You may improve this article, discuss the issue on the talk page, or create a new article, as appropriate. August 2015, learn how and when to remove this template message. Geneticist working with a pedigree. There are a variety of career paths within the field of medical genetics, and naturally the training required for each area differs considerably. The information included in this section applies to the typical pathways in the United States, and there may be differences in other countries. U.S. practitioners in clinical, counseling, or diagnostic subspecialties generally obtain board certification through the American Board of Medical Genetics. Career degree description training. Clinical geneticist MD, DO, MD PhD or MBBS. A clinical geneticist is typically a physician who evaluates patients in the office or as a hospital consultation. This process includes a medical history, family history, pedigree, a detailed physical examination, reviewing objective data such as imaging and test results, establishing a differential diagnosis, and recommending appropriate diagnostic tests. College, 4 years, medical school, 4 years, primary residency, 1 year, residency in clinical genetics, 2 years. Some clinical geneticists also obtain a PhD degree, 4 to 7 years. A new residency track offers a 4 years primary residency in clinical genetics immediately after finishing medical school, citation needed. Genetic counselor MS. A genetic counselor specializes in communication of genetic information to patients and families. Genetic counselors often work closely with clinical geneticists or other physicians, such as obstetricians or oncologists, and often convey the results of the recommended tests. College, 4 years, graduate program in genetic counseling, 2 years. Metabolic nurse and/or nutritionist BA/BS, MS, RN. One of the critical aspects of the management of patients with metabolic disorders is the appropriate nutritional intervention, either restricting the compound that cannot be metabolized, or supplementing compounds that are deficient as the result of an enzyme deficiency. The metabolic nurse and nutritionist play important roles in coordinating the dietary management. College, 4 years, nursing school or graduate training in nutrition. Biochemical diagnostics BS, MS, PhD, MD, DO, MD PhD. Individuals who specialize in biochemical genetics typically work in the diagnostic laboratory, analyzing and interpreting specialized biochemical tests that measure amino acids, organic acids, and enzyme activity. Some clinical geneticists are also board certified in biochemical genetics. College, 4 years, graduate school, PhD, usually 4 to 7 years, and/or medical school, 4 years. Cytogenetic diagnostics BS, MS, PhD, MD, DO, MD PhD. Individuals who specialize in cytogenetics typically work in the diagnostic laboratory, analyzing and interpreting karyotypes, FISH, and comparative genomic hybridization tests. Some clinical geneticists are also board certified in cytogenetics. College, 4 years, graduate school, PhD, usually 4 to 7 years, and/or medical school, 4 years. Molecular genetics BS, MS, PhD, MD, DO, MD PhD. Individuals who specialize in molecular genetics typically work in the diagnostic laboratory, analyzing and interpreting specialized genetic tests that look for disease-causing changes, mutations, in the DNA. Some examples of molecular diagnostic tests include DNA sequencing and Southern blotting. College, 4 years, graduate school, PhD, usually 4 to 7 years, and/or medical school, 4 years. Research geneticist BS, MS, PhD, MD, DO, MD PhD. Any researcher who studies the genetic basis of human disease or uses model organisms to study disease mechanisms could be considered a research geneticist. Many of the clinical career paths also include basic or translational research, and thus individuals in the field of medical genetics often participate in some form of research. College, 4 years, graduate school, PhD, usually 4 to 7 years, and/or medical school, 4 years, postdoctoral research training, usually 3+ years. Laboratory technician AS, BS, MS. Technicians in the diagnostic or research labs handle samples and run the assays at the bench. College, 4 years, may have higher degree, MS, 2+ years. Ethical, legal, and social implications. Genetic information provides a unique type of knowledge about an individual and his/her family, fundamentally different from a typically laboratory test that provides a snapshot of an individual's health status. The unique status of genetic information and inherited disease has a number of ramifications with regard to ethical, legal, and societal concerns. On March 19, 2015, scientists urged a worldwide ban on clinical use of methods, particularly the use of CRISPR and zinc finger, to edit the human genome in a way that can be inherited. 7, 8, 9, 10. In April 2015 and April 2016, Chinese researchers reported results of basic research to edit the DNA of non-viable human embryos using CRISPR. 11, 12, 13. In February 2016, British scientists were given permission by regulators to genetically modify human embryos by using CRISPR and related techniques, on condition that the embryos were destroyed within 7 days. 14. In June 2016, the Dutch government was reported to be planning to follow suit with similar regulations which would specify a 14-day limit. 15. Societies. The more empirical approach to human and medical genetics was formalized by the founding in 1948 of the American Society of Human Genetics. The society first began annual meetings that year, 1948, and its international counterpart, the International Congress of Human Genetics, has met every 5 years since its inception in 1956. The society publishes the American Journal of Human Genetics on a monthly basis. Medical genetics is recognized as a distinct medical specialty. In the U.S., medical genetics has its own approved board, the American Board of Medical Genetics, and Clinical Specialty College, the American College of Medical Genetics. The college holds an annual scientific meeting, publishes a monthly journal, Genetics in Medicine, and issues position papers and clinical practice guidelines on a variety of topics relevant to human genetics. In Australia and New Zealand, medical geneticists are trained and certified under the auspices of the Royal Australasian College of Physicians, but professionally belong to the Human Genetics Society of Australasia and its special interest group, the Australasian Association of Clinical Geneticists, for ongoing education, networking and advocacy. Research. Icon. This section needs expansion with more details and additional citations. You can help by adding to it. August 2008. The broad range of research in medical genetics reflects the overall scope of this field, including basic research on genetic inheritance and the human genome, mechanisms of genetic and metabolic disorders, translational research on new treatment modalities, and the impact of genetic testing. Basic genetics research. Basic research geneticists usually undertake research in universities, biotechnology firms and research institutes. Allelic architecture of disease. Main article. Population groups in biomedicine. Sometimes the link between a disease and an unusual gene variant is more subtle. The genetic architecture of common diseases is an important factor in determining the extent to which patterns of genetic variation influence group differences in health outcomes. 16, 17, 18, according to the common disease/common variant hypothesis. Common variants present in the ancestral population before the dispersal of modern humans from Africa play an important role in human diseases. 19. Genetic variants associated with Alzheimer's disease, deep venous thrombosis, Crohn's disease, and type 2 diabetes appear to adhere to this model. 20. However, the generality of the model has not yet been established and, in some cases, is in doubt. 17. 21, 22, some diseases, such as many common cancers, appear not to be well described by the common disease/common variant model. 23. Another possibility is that common diseases arise in part through the action of combinations of variants that are individually rare. 24, 25, most of the disease-associated alleles discovered to date have been rare, and rare variants are more likely than common variants to be differentially distributed among groups distinguished by ancestry. 23. 26, however, groups could harbor different, though perhaps overlapping, sets of rare variants, which would reduce contrasts between groups in the incidence of the disease. The number of variants contributing to a disease and the interactions among those variants also could influence the distribution of diseases among groups. The difficulty that has been encountered in finding contributory alleles for complex diseases and in replicating positive associations suggests that many complex diseases involve numerous variants rather than a moderate number of alleles, and the influence of any given variant may depend in critical ways on the genetic and environmental background. 21, 27, 28, 29. If many alleles are required to increase susceptibility to a disease, the odds are low that the necessary combination of alleles would become concentrated in a particular group purely through drift. 30. Population substructure in genetics research. Further information, population structure, genetics. One area in which population categories can be important considerations in genetics research is in controlling for confounding between population substructure, environmental exposures, and health outcomes. Association studies can produce spurious results if cases and controls have differing allele frequencies for genes that are not related to the disease being studied. 31. Although the magnitude of this problem in genetic association studies is subject to debate. 32. 33. Various methods have been developed to detect and account for population substructure. 34. 35. But these methods can be difficult to apply in practice. 36. Population substructure also can be used to advantage in genetic association studies. 37. For example, populations that represent recent mixtures of geographically separated ancestral groups can exhibit longer-range linkage disequilibrium between susceptibility alleles and genetic markers than is the case for other populations. 38, 39, 40, 41. Genetic studies can use this admixture linkage disequilibrium to search for disease alleles with fewer markers than would be needed otherwise. Association studies also can take advantage of the contrasting experiences of racial or ethnic groups, including migrant groups, to search for interactions between particular alleles and environmental factors that might influence health. 42-43. Health technology is defined by the World Health Organization as the application of organized knowledge and skills in the form of devices, medicines, vaccines, procedures, and systems developed to solve a health problem and improve quality of lives. 1. This includes pharmaceuticals, devices, procedures, and organizational systems used in the healthcare industry. 2. As well as computer-supported information systems. In the United States, these technologies involve standardized physical objects, as well as traditional and designed social means and methods to treat or care for patients. 3. Development. Pre-digital era. During a pre-digital era, patients suffered from inefficient and faulty clinical systems, processes, and conditions. 4. Many medical errors happened in the past due to undeveloped health technologies. Citation needed. Some examples of these medical errors included adverse drug events and alarm fatigue. Alarm fatigue is caused when an alarm is repeatedly triggered or activated and one becomes desensitized to them. As the alarms were sometimes triggered by unimportant events in the past, nurses thought the alarm was not significant. Alarm fatigue is dangerous because it could lead to death in dangerous situations. With technological development, an intelligent program of integration and physiologic sense-making was developed and helped reduce the number of false alarms. 4. Also, with greater investment in health technologies, fewer medical errors happened. Citation needed. Outdated paper records were replaced in many healthcare organizations by electronic health records, EHR. Citation needed. According to studies, this change has brought a lot of changes to healthcare. 5. Drug administration has improved. Healthcare providers can now access medical information easier, provide better treatments and faster results, and save more costs. 5. Improvement. To help promote and expand the adoption of health information technology, Congress passed the HITECH Act as part of the American Recovery and Reinvestment Act of 2009. HITECH stands for Health Information Technology for Economic and Clinical Health Act. It gave the Department of Health and Human Services the authority to improve healthcare quality and efficiency through the promotion of health IT. 6. The Act provided financial incentives or penalties to organizations to motivate healthcare providers to improve healthcare. The purpose of the Act was to improve quality, safety, efficiency, and ultimately to reduce health disparities. 7. One of the main parts of the HITECH Act was setting the meaningful use requirement, which required EHRs to allow for the electronic exchange of health information and to submit clinical information. The purpose of HITECH is to ensure the sharing of electronic information with patients and other clinicians are secure. HITECH also aimed to help healthcare providers have more efficient operations and reduce medical errors. The program consisted of 3 phases. Phase 1 aimed to improve healthcare quality, safety and efficiency. 7. Phase 2 expanded on Phase 1 and focused on clinical processes and ensuring the meaningful use of EHRs. 7. Lastly, Phase 3 focused on using certified electronic health record technology, CEHRT, to improve health outcomes. 7. In 2014, the implementation of electronic records in U.S. hospitals rose from a low percentage of 10% to a high percentage of 70%. 4. At the beginning of 2018, healthcare providers who participated in the Medicare Promoting Interoperability program needed to report on quality payment program requirements. The program focused more on interoperability and aimed to improve patient access to health information. 7. Privacy of health data. Phones that can track one's whereabouts, steps and more can serve as medical devices, and medical devices have much the same effect as these phones. In the research article, Privacy Attitudes Among Early Adopters of Emerging Health Technologies by Cynthia Chung, Matthew Beats, Kevin Patrick and Cinnamon Bloss discovered people were willing to share personal data for scientific advancements, although they still expressed uncertainty about who would have access to their data. People are naturally cautious about giving out sensitive personal information. 8. Phones add an extra level of threat according to the research article Security in Cloud Computing-Based Mobile Health. Mobile devices continue to increase in popularity each year. The addition of mobile devices serving as medical devices increases the chances for an attacker to gain unauthorized information. 9. In 2015, the Medical Access and Chip Reauthorization Act, MACRA, was passed, pushing towards electronic health records. Health information technology, integration, patient empowerment, and Security by K. Marvin provided multiple different polls based on people's views on different types of technology entering the medical field. Most answers were responded with somewhat likely and very few completely disagreed on the technology being used in medicine. Marvin discusses the maintenance required to protect medical data and technology against cyber attacks as well as providing a proper data backup system for the information. 10. Patient Protection and Affordable Care Act, ACA, also known as Obamacare and Health Information Technology. Healthcare is entering the digital era. Although with this development it needs to be protected. Both health information and financial information now made digital within the health industry might become a larger target for cybercrime. Even with multiple different types of safeguards, hackers somehow still find their way in, so the security that is in place needs to constantly be updated to prevent these breaches. 11. Policy. With the increased use of IT systems, privacy violations were increasing rapidly due to the easier access and poor management. As such, the concern of privacy has become an important topic in healthcare. Privacy breaches happen when organizations do not protect the privacy of people's data. There are 4 types of privacy breaches, which include unintended disclosure by authorized personnel, intended disclosure by authorized personnel, privacy data loss or theft, and virtual hacking. It became more important to protect the privacy and security of patients' data because of the high negative impact on both individuals and organizations. Stolen personal information can be used to open credit cards or other unethical behaviors. Also, individuals have to spend a large amount of money to rectify the issue. The exposure of sensitive health information also can cause negative impacts on individuals' relationships, jobs, or other personal areas. For the organization, the privacy breach can cause loss of trust, customers, legal actions, and monetary fines. 12. HIPAA, Health Insurance Portability and Accountability Act of 1996. HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. It is a U.S. healthcare legislation to direct how patient data is used and includes 2 major rules, which are privacy and security of data. The privacy rule protects people's rights to privacy and security rule determines how to protect people's privacy. 13. According to the HIPAA security rule, it ensures that protected health information has 3 characteristics. They are confidentiality, availability, and integrity. Confidentiality indicates keeping the data confidential to prevent data loss or individuals who are unauthorized to access that protected health information. Availability allows people who are authorized to access the systems and networks when and where that information is in fact needed, such as natural disasters. In cases like this, protected health information is mostly backed up onto a separate server or printed out in paper copies, so people can access it. Lastly, integrity ensures not using inaccurate information and improperly modified data due to a bad design system or process to protect the permanence of the patient data. The consequences of using inaccurate or improperly modified data could become useless or even dangerous. 13. Health organizations of HIPAA also created administrative safeguards, physical safeguards, technical safeguards, to help protect the privacy of patients. Administrative safeguards typically include security management process, security personnel, information access management, workforce training and management, and evaluation of security policies and procedures. Security management processes are one of the important administrative safeguards examples. It is essential to reduce the risks and vulnerabilities of the system. The processes are mostly the standard operating procedures written out as training manuals. The purpose is to educate people on how to handle protected health information in proper behavior. 14. Physical safeguards include lock and key, card swipe, positioning of screens, confidential envelopes, and shredding of paper copies. Lock and key are common examples of physical safeguards. They can limit physical access to facilities. Lock and key are simple, but they can prevent individuals from stealing medical records. Individuals must have an actual key to access to the lock. 14. Lastly, technical safeguards include access control, audit controls, integrity controls, and transmission security. The access control mechanism is a common example of technical safeguards. It allows the access of authorized personnel. The technology includes authentication and authorization. Authentication is the proof of identity that handles confidential information like username and password, while authorization is the act of determining whether a particular user is allowed to access certain data and perform activities in a system like add and delete. 14. Assessment. Main article, Health Technology Assessment. The concept of Health Technology Assessment, HTA, was first coined in 1967 by the U.S. Congress in response to the increasing need to address the unintended and potential consequences of health technology, along with its prominent role in society. 15. It was further institutionalized with the establishment of the Congressional Office of Technology Assessment, OTA, in 1972 to 1973. HTA is defined as a comprehensive form of policy research that examines short and long-term consequences of the application of technology, including benefits, costs, and risks. 16. Due to the broad scope of technology assessment, it requires the participation of individuals besides scientists and healthcare practitioners such as managers and even the consumers. 16. Several American organizations provide health technology assessments, and these include the Centers for Medicare and Medicaid Services, CMS, and the Veterans Administration through its VA Technology Assessment Program, VATAP. The models adopted by these institutions vary, although they focus on whether a medical technology being offered is therapeutically relevant. 17. A study conducted in 2007 noted that the assessment still did not use formal economic analyses. 17. Aside from its development, however, assessment in the health technology industry has been viewed as sporadic and fragmented. 18. Issues such as the determination of products that needed to be developed, cost, and access, among others, also emerged. These, some argue, need to be included in the assessment since health technology is never purely a matter of science but also of beliefs, values, and ideologies. 18. One of the mechanisms being suggested, either as an element of or an alternative to the current TAs, is bioethics, which is also referred to as the fourth-generation evaluation framework. 18. 19. There are at least two dimensions to an ethical HTA. The first involves the incorporation of ethics in the methodological standards employed to assess technologies, while the second is concerned with the use of ethical framework in research and judgment on the part of the researchers who produce information used in the industry. 20. Health technology in the future. The practice of medicine in the United States is currently in a major transition. This transition is due to many factors, but primarily because of the implementation and integration of health technologies into healthcare. In recent years, the widespread adoption of electronic health records, EHR, has caused a big impact on healthcare. The Digital Doctor, Hope, Hype, and Harm at the Dawn of Medicine's Computer Age, by Robert Wachter, aims to inform readers about this transition. Dr. Wachter has reviewed and made points about the future of health technologies in the book. He states that there will be fewer hospitals in the future. Due to the advancement of technologies, people will be more likely to go to hospitals for major surgeries or critical illness. In the future, nurse call buttons will not be needed in hospitals. Instead, robots will deliver medication, take care of patients, and administer the system. In the future, the electronic health record will look different. Healthcare providers will be able to enter the notes via speech-to-text transcriptions in real time. 4. Dr. Wachter stated that information will be edited collaboratively across the patient care team to improve the quality. Also, natural language processing will be more developed to help parse out keywords. In the future, patient data will reside in the cloud. Patients will be able to access their data from any device or location. The data is also accessible for authorized providers and individuals. In the future, big data analysis will constantly be improving. Artificial intelligence and machine learning will be constantly improving and developing as it receives new data. Alerts will also be more intelligent and efficient than the current systems. 4. Medical technology. Medical technology, or medtech, encompasses a wide range of healthcare products and is used to treat diseases and medical conditions affecting humans. Such technologies are intended to improve the quality of healthcare delivered through earlier diagnosis, less invasive treatment options, and reduction in hospital stays and rehabilitation times. 21. Recent advances in medical technology have also focused on cost reduction. 22. Medical technology may broadly include medical devices, information technology, biotech, and healthcare services. The impacts of medical technology involve social and ethical issues. For example, physicians can seek objective information from technology rather than read subjective patient reports. 23. A major driver of the sector's growth is the consumerization of medtech. Supported by the widespread availability of smartphones and tablets, providers can reach a large audience at low cost, a trend that stands to be consolidated as wearable technologies spread throughout the market. 24. In the years 2010 to 2015, venture funding has grown 200%, allowing $11.7 billion to flow into health tech businesses from over 30,000 investors in the space. 25. Types of technology. Medical technology has evolved into smaller portable devices, for instance, smartphones, touchscreens, tablets, laptops, digital ink, voice and face recognition and more. With this technology, innovations like electronic health records, EHR, Health Information Exchange, HIE, Nationwide Health Information Network, NWHIN, personal health records, PHRs, patient portals, nanomedicine, genome-based personalized medicine, geographical positioning system, GPS, radio frequency identification, RFID, telemedicine, clinical decision support, CDS, mobile home health care and cloud computing came to exist. 26. Medical imaging and magnetic resonance imaging, MRI, have been long used and proven medical technologies for medical research, patient reviewing, and treatment analyzing. With the advancement of imaging technologies, including the use of faster and more data, higher resolution images, and specialist automation software, the capabilities of medical imaging technology are growing and yielding better results. 27. As the imaging hardware and software evolve, this means that patients will need to use less contrasting agents, and also spend less time and money. 28. Further advancement in healthcare is electromagnetic, EM, technology guidance systems, used in medical procedures, allowing real-time visualization and navigation for the placement of medical devices inside the human body. For example, a neuronavigated catheter is inserted into the brain, or a feeding tube placement in the stomach or small intestine, as demonstrated by the ENVO system. ENVO is an advanced electromagnetic navigation system for enteral feeding tube placement. The system uses a field generator and several EM sensors, enabling proper scaling of the display to the patient's body contour, and real-time view of the feeding tube tip location and direction, which helps the medical staff ensure correct placement and avoid placement of the tube in the lungs. 29. 3D printing is another major development in healthcare. 3D printing is the use of specialized machines, software programs and materials to automate the process of building certain objects. It is having a rapid growth in the prosthesis, medical implants, novel drug formulations and the bioprinting of human tissues and organs. 30. Companies such as Surgical Theater provide new technology that is capable of capturing 3D virtual images of patients' brains to use as practice for operations. 3D printing allows medical companies to produce prototypes to practice before an operation created with artificial tissue. 30. 3D printing technologies are great for biomedicine because the materials that are used to make allow the fabrication with control over many design features. 3D printing also has the benefits of affordable customization, more efficient designs, and saving more time. 30. 3D printing is precise to design pills to house several drugs due to different release times. The technology allows the pills to transport to the targeted area and degrade safely in the body. As such, pills can be designed more efficiently and conveniently. In the future, doctors might be giving a digital file of printing instructions instead of a prescription. 30. Besides, 3D printing will be more useful in medical implants. An example includes a surgical team that has designed a tracheal splint made by 3D printing to improve the respiration of a patient. This example shows the potential of 3D printing, which allows physicians to develop new implant and instrument designs easily. 30. Overall, in the future of medicine, 3D printing will be crucial as it can be used in surgical planning, artificial and prosthetic devices, drugs, and medical implants. Artificial intelligence. Main article: Artificial Intelligence in Healthcare. Artificial intelligence, AI, is a program that enables computers to sense, reason, act and adapt. AI is not new, but it is growing rapidly and tremendously. AI can now deal with large data sets, solve problems, and provide more efficient operation. AI will be more potential in healthcare because it provides easier accessibility of information, improves healthcare, and reduce cost. 32. There are different factors that drive AI in healthcare, but the two most important are economics and the advent of big data analytics. Costs, new payment options, and people's desire to improve health outcomes are the primary economic drivers of the AI. Based on the reading, AI can save $150 million annually in the US by 2026. Also, AI growth is expected to reach $6.6 million by 2021, 32. Big data analytics is another big driver because we are in the age of big data. The data is extremely helpful to assist the integration of AI in healthcare because it ensures the execution of complex tasks, quality, and efficiency. Applications of artificial intelligence. AI brings many benefits to the healthcare industry. AI helps to detect diseases, administer chronic conditions, deliver health services, and discover the drug. Also, AI has the potential to address important health challenges. In healthcare organizations, AI is able to plan and relocate resources. 33. AI is able to match patients with healthcare providers that meet their needs. AI also helps improve the healthcare experience by using an app to identify patients' anxieties. In medical research, AI helps to analyze and evaluate the patterns and complex data. For instance, AI is important in drug discovery because it can search relevant studies and analyze different kinds of data. In clinical care, AI helps to detect diseases, analyze clinical data, publications, and guidelines. As such, AI aids to find the best treatments for the patients. Other uses of AI in clinical care include medical imaging, echocardiography, screening, and surgery. 33. Medical virtual reality provides doctors multiple surgical scenarios that could happen and allows them to practice and prepare themselves for these situations. It also permits medical students a hands-on experience of different procedures without the consequences of making potential mistakes. 34. Orama VR is one of the leading companies that employ such medical virtual reality technologies to transform medical education, knowledge, and training skills to improve patient outcomes, reduce surgical errors and training time, and democratize medical education and training. Robots. Modern robotics have made huge progress and contribution to healthcare. Robots can help doctors in performing variety tasks. Robotics adoption is increasing tremendously in hospitals. The following are different ways to improve healthcare by using robots. Frowny face. 35. Robotic spinal surgery. Robotic spinal surgery. Surgical robots are one of the robotic systems, which allows a surgeon to bend and rotate tissues in a more flexible and efficient way. The system is equipped with a 3D magnification vision system that can translate the hand movements of the surgeon to be precise in order to perform a surgery with minimal incisions. Other robotics systems include the ability to diagnose and treat cancers. Many scientists began working on creating a next-generation robot system to assist the surgeon in performing knee and other bone replacement surgeries. 35. Assistant robots will also be important to help reduce the workload for regular medical staff. They can help nurses with simple and time-consuming tasks like carrying multiple racks of medicines, lab specimen, or other sensitive materials. 35. Shortly, robotic pills are expected to reduce the number of surgeries. 35. They can be moved inside a patient and delivered to the desired area. In addition, they can conduct biopsies, film the area, and clear clogged arteries. Overall, medical robots are extremely useful in assisting physicians. However, it might take time to be professionally trained working with medical robots and for the robots to respond to a clinician's instructions. As such, many researchers and startups were working constantly to provide solutions to these challenges. 35. Assistive technologies. Assistive technologies are products designed to provide accessibility to individuals who have physical or cognitive problems or disabilities. They aim to improve the quality of life with assistive technologies. The range of assistive technologies is broad, ranging from low-tech solutions to physical hardware, to technical devices. There are 4 areas of assistive technologies, which include visual impairment, hearing impairment, physical limitations, cognitive limitations. There are many benefits of assistive technologies. They enable individuals to care for themselves, work, study, access information easily, improve independence and communication, and lastly participate fully in community life. 36. Consumer-driven healthcare software. As part of an ongoing trend towards consumer-driven healthcare, websites or apps which provide more information on healthcare quality and price to help patients choose their providers have grown. 37. As of 2017, the sites with the most number of reviews in descending order included Healthgrades, Vitals.com, and RateMDs.com. 38. Yelp, Google, and Facebook also host reviews with a large amount of traffic, although as of 2017 they had fewer medical reviews per doctor. 39. Disputes around online reviews can lead to websites by health professionals alleging defamation. 40. In 2018 Vitals.com was purchased by WebMD, which is owned by Internet Brands. 41. Patient safety organizations and government programs which have historically assessed quality have made their data more accessible over the Internet. Notable examples include the Hospital Compare by CMS, 42, and the Leapfrog Group's HospitalSafetyGrade.org, 43. Patient-oriented software may also help in other ways, including general education and appointments. 44. Disclosure of legal disputes including medical license complaints or malpractice lawsuits has also been made easier. Every state discloses license status and at least some disciplinary action to the public, but as of 2018, this was not accessible via the Internet for a few states. 45. 78 consumers can look up medical licenses in a national database, docinfo.org, maintained by the medical licensing organizations. 45, which contains limited details. 46. Other tools include DocFinder at docfinder.docboard.org, 46, and certificationmatters.org from the American Board of Medical Specialties. In some cases more information is available from a mailed or walk-in request than the Internet. For example, the Medical Board of California removes dismissed accusations from website profiles, but these are still available from a written or walk-in request, or a lookup in a separate database. 47. The trend to disclosure is controversial and generates significant public debate. 48. Particularly about opening up the National Practitioner Data Bank. 49. In 1996, Massachusetts became the first state to require detailed disclosure of malpractice claims. 49. Self-monitoring. Further information, quantified self. Smartphones, tablets, and wearable computers have allowed people to monitor their health. These devices run numerous applications that are designed to provide simple health services and the monitoring of one's health with finding as critical problems to health as possible. An example of this is Fitbit, a fitness tracker that is worn on the user's wrist. This wearable technology allows people to track their steps, heart rate, floors climbed, miles walked, active minutes, and even sleep patterns. The data collected and analyzed allow users not just to keep track of their health but also help manage it, particularly through its capability to identify health risk factors. 50. There is also the case of the Internet, which serves as a repository of information and expert content that can be used to self-diagnose instead of going to their doctor. For instance, one need only enumerate symptoms as search parameters at Google and the search engine could identify the illness from the list of contents uploaded to the World Wide Web, particularly those provided by expert/medical sources. These advances may eventually have some effect on doctor visits from patients. 51, and change the role of the health professionals from gatekeeper to secondary care to facilitator of information interpretation and decision-making. 52, apart from basic services provided by Google in search, there are also companies such as WebMD that already offer dedicated symptom-checking apps. 53. Technology testing. All medical equipment introduced commercially must meet both United States and international regulations. The devices are tested on their material, effects on the human body, all components including devices that have other devices included with them, and the mechanical aspects. 54. The Medical Device User Fee and Modernization Act of 2002 was created to speed up the FDA's approval process of medical technology by introducing sponsor user fees for a faster review time with predetermined performance targets for review time. 55. In addition, 36 devices and apps were approved by the FDA in 2016. 56. Careers. There are numerous careers to choose from in health technology in the USA. Listed below are some job titles and average salaries. Athletic trainer, mean salary, $41,340. Athletic trainers treat athletes and other individuals who have sustained injuries. They also teach people how to prevent injuries. They perform their job under the supervision of physicians. 57. Dental hygienist, mean salary, $67,340. Dental hygienists provide preventive dental care and teach patients how to maintain good oral health. They usually work under dentist supervision. 57. Clinical laboratory scientists, technicians, and technologists, mean salary, $51,770. Lab technicians and technologists perform laboratory tests and procedures. Technicians work under the supervision of a laboratory technologist or laboratory manager. 58. Nuclear medicine technologist, mean salary, $67,910. Nuclear medicine technologists prepare and administer radiopharmaceuticals, radioactive drugs, to patients to treat or diagnose diseases, 57. Pharmacy technician, mean salary, $28,070. Pharmacy technicians assist pharmacists with the preparation of prescription medications for customers, 57. Allied professions. The term medical technology may also refer to the duties performed by clinical laboratory professionals or medical technologists in various settings within the public and private sectors. The work of these professionals encompasses clinical applications of chemistry, genetics, hematology, immunohematology, blood banking, immunology, microbiology, serology, urinalysis, and miscellaneous body fluid analysis. Depending on location, educational level, and certifying body, these professionals may be referred to as biomedical scientists, medical laboratory scientists, MLS, medical technologists, MT, medical laboratory technologists and medical laboratory technicians, 59.